Okay.
And there were going to be a couple people that were like 15 or 20 minutes late. I know Caroline and I can't remember who else it was.
Letitia.
Yes.
Just came through.
Hi, Ron.
Just waiting on one more.
Are we still looking for 11 for a quorum, or is it less than that?
11. We need one more.
Okay.
Oh, wait, we may have gotten it.
I was going to say, oh, there's one.
Yep.
I just came on.
Annalise saved the day.
There's still waiting, aren't we?
No, we're at quorum.
Yeah,
Okay.
go ahead.
Great. Good afternoon. Feel like it's still morning. It's really, really not. It's nice to see some new faces and some familiar faces. I'm going to start with my OAC introduction that we do every time. My name is Abby Stamp. My pronouns are she and her, and I'm the Executive Director of Measure 110 for the Oregon Health Authority. And I'll be assisting Dharma, our remaining tri-chair. So she is our chair until we have elections. With facilitation for today's meeting. The Oversight and Accountability Council welcomes and encourages input from the community. The members of the public are invited to submit public comments or get onto our interested parties email list by emailing oha.measure110@oha.oregon.gov. That email address and more information about the council can be found on the Measure 110 OAC website. OAC members have asked that OHA and other staff who are present in the meeting introduce themselves in the chat. Please share your role with the agency, and if you are a subject matter expert, what your area of expertise is. I'll now turn it over to Dharma. Opening remarks.
Hi, everyone. And for the new folks joining, my name is Dharma, she, her pronouns, the tri-chair for Measure 110. One of the tri-chairs, I guess the only tri-chair for now. And I just want to go over the agenda. Today, we just have the introductions and welcoming our new OAC members. And we have quite a few county burn presentation or funding decisions to make. So I'm just going to pass it on to Carly to do attendance.
Thank you, Dharma. Ami.
Here.
Thank you. Amy. Caroline's going to be a little late. Dharma.
Here.
Hubert. See here. Hunter.
Here.
Jackie. Josh.
Here.
Keisha.
Here.
Leticia. She was going to be late. Linda.
Here.
Mason.
I'm here.
Melinda. Oh, she's an old member. Sorry about that. Melissa, I think she's having some trouble getting in. I'm going to help her after this. Morgan. Bron.
Here.
Brian.
Here.
Sabrina. Zeb is not here. Wait one moment. Sorry, this is showing that we don't have quorum, but I need to check it again. And Annalise,
I'm here.
okay, so bad news, we don't have quorum yet unless someone um, jumped in. I'm going to double check my numbers real quick, but we're at 10.
Great. I mean, not great. Thank you. Thank you for checking that. Shannon, I just want to make sure I'm not doing anything wrong here. I see. But when we don't have quorum, but we are recording in public, can we just like chat about like who you are and things like that? Or should we just like sit here and wait until we do have quorum before we even start?
Thanks, Abby. Shannon O'Fallon, she, her pronouns, Oregon Department of Justice. Yeah, I mean the council just can't engage in any business. So if there's other, like if OHA wanted to do its report out, for example, on things, or right, there are new members to do some introductions, I think that's all a fair game.
Great. Perfect. And this is Shannon O'Fallon. She's the attorney who supports OHA, particularly Measure 110 and the OAC, with all of the rules and the laws and the things that we all make sure that we're compliant with together. Great.
Oh,
Thanks.
and Hubert just joined, so we are at quorum.
Hi, Hubert. Great. So, Dharma, back to you.
Hello, everybody. I'm here.
Hey, Hubert.
Well, I'm going to pass it right back to you, Abby, to maybe facilitate some introductions.
Oh, I will. Let's play ping pong when we see each other. So I am incredibly excited to welcome the new members of the OAC, and I want to appreciate the effort it took to apply and your interest, and thank you for that. And also really appreciating the folks who had already given so many years of service to the OAC before your arrival. So we got to celebrate them last week, and now we get to celebrate you coming. So I first want to just state and apologize that we don't have the time or ability right now to be together in person and really do it right, but getting to know each other and, you know, me helping support your work together as a council and us as your staff and support. And I absolutely would love to continue to work with Dharma and the incoming chairs about how to do that when we have some bandwidth to do so. And I also want to apologize that we're jumping just right into like quick introductions and decision making today. I will make sure to do my very best to give enough background so that the new members of OAC feel like you're on the same page and you're kind of caught up with the work to date. And I want to thank Carly for reaching out to you individually since your terms really only started on Monday, day 3, and here we go. So I just want to recognize that that's a unfortunate tension, and also perhaps an opportunity. So I wanted to just start with doing some introductions, and here, let me, I'll just put this on the screen for a minute. I made a slideshow and it's pretty simple, but basically I was hoping, and I'll take this down in a minute. And actually, Carly, could you nab this and just put it in the chat so we can actually look at each other and engage in a real conversation for folks who are able to and feel comfortable putting on their canvas. It would be great to see each other while we're getting to know one another. If folks could just take a turn and maybe, I don't know if Dharma, if you want to call on folks or just do the popcorn and call on somebody else your name, your preferred pronouns, why you decided you wanted to be on the OAC, and if you could share a little something, if you feel comfortable, about who or what most influenced you to get into this kind of work, and that what kind of passion ended up bringing you here to do this work with the OAC. I think that would be really fantastic to share with one another. So with that, who would like to start?
Just call on someone random, Abby, but not me.
Oh, that's nice. Okay, I'm just gonna go, no, you know what? I'm gonna bring up my participant tab. I'm gonna do it this way. And I'm going to start at the top and work my way down. So you can just watch for your name. And I'm going to start, and we'll just do OAC members. And the first is Ame.
Good afternoon, everyone. My name is Ami McPhee. My pronouns are she, her. Why I chose to be a part of the OAC. Honestly, I was kind of encouraged heavily to apply. Um, but I also know it's a big role. And as a person being in nonprofit, thank you, Sabrina, for the last 7 years, and have observed a lot, and also someone with lived experience. I definitely feel like I earned my seat, and I definitely feel like I can be a voice to those who cannot be. Who's most influenced me? Oh my goodness, so many people who have came in and out of my life, both professionally or who have supported me in my recovery. Um, so I can't really directly say like a specific person. Yep. Thank you.
Thank you, Ami. I will get your name pronunciation right. It's really nice to meet you. Going down the list alphabetical, next OAC members, Annalise.
Hi, all. Annalise Dolph. I use she, her pronouns. I am a non-voting member of the ADPC. I'm the director at the Alcohol and Drug Policy Commission. And I also co-chair the Opioid Settlement Board, which Zeb Payne, who's not here today, also sits on with me. And for those of you who don't know about the Alcohol and Drug Policy Commission, we work across 14 participating state agencies with the goal of trying to have a comprehensive strategy that all the agencies align with. So I get to work with not just OHA and my commissioners, but other agencies like the Oregon Youth Authority and Department of Human Services, Office of State Police, Oregon Liquor and Cannabis Commission. And so I have a little team that we think about substance use disorder all day, every day. The people that I hear from every day who live with substance use, who are drug users, who are in recovery, their families, their children. That's why I do the work that I do and love sitting at this table with all of you. And welcome to the new members.
Thanks, Annalise. And Caroline's timing is perfect. Hi, Caroline. You are, you're in the passenger seat, I'm asserting. Yes, I hope.
Oh yeah. I'm not driving. It's just that I was in the dead zone. So and then I'm using my iPhone to get on my computer.
Got
So,
you.
but I got on. It took
Multitasking.
me a little time, but I got on. So what are we doing? Are we introducing ourselves or what are we
We are
doing?
introducing ourselves because we have some new members joining us today.
Yes.
So your name, pronouns, if you're affiliated with any organization, and kind of what's your passion behind doing this type of work.
Okay. So welcome new members. I'm Caroline Cruz. I'm with the Confederate Tribes of Warm Springs, and I am now the Health and Human Services Tribal Liaison. I was the General Manager for Health and Human Services for the last 16 years. My compassion has always been in the field. I have, gosh, I don't know. I hate to say it's maybe 50 plus years in the field. And so that's my compassion, and it will always be my compassion. So welcome all new members.
Awesome. Thank you, Caroline. Dharma.
Yeah, hi folks. I'm Dharma again. I use she, her pronouns. Full name's Dharma Krishna, but either one's fine. I chose the OAC because I'm as a trans woman of color who uses drugs, who's in recovery. It's very important, I think, to have representation here for consumers as well as folks who are in recovery in all sorts of different versions of recovery. I'm a harm reductionist by trade. I also am a PhD student at Oregon State University studying drug policy as part of the Women, Gender, Sexuality Studies program in public health. With a background in public health, mainly around substance use disorder stuff from the cultural perspective. And I do research as well. Research is my jam, kind of around health equity and decolonizing methods around drug use. So that's, yeah, I think the inspirations for the OAC work comes from like Sylvia Rivera and folks other trans women of color who were people who use drugs who resisted systems of oppression. And that's why I'm here. Yeah.
Thanks, Dharma. Hubert. Hubert, can you hear me? Maybe you're on mute still? Well, we'll see if he's able to. We're going to keep going. Next is Hunter.
Hey everybody, my name is Hunter Nelms. I use he, him pronouns. I am the clinical supervisor and SUDS program manager at a place called Live, Grow, Share here in Lane County. Why the OAC? I was encouraged by several people when a spot came open a couple of years ago to be here, and I had several friends that were involved with it. And at the time, I was working at a Measure 110 startup, so I had been paying attention to all of the things and hoping that our grant got picked. And so I've been watching all the things. I'm no longer working there. I work at a different agency, but I find myself here, and I love the work that we do here on the OAC. And who influenced me? So it's a long list. I've had a lot of really strong women who have been mentors to me and showed me how to do this work. And so uh, to name one would be probably to do a disservice to the other ones. But yeah, I've had a lot of good mentors on the way up, and I'm happy to be here. And welcome to everybody. It's good to see you, Josh.
And Josh is next. Welcome.
Hey everyone, my name is Josh Gottlieb. I use he, him pronouns. I am the founder and executive director of two organizations here in Oregon, Insight Northwest Counseling and Insight Northwest Recovery. I'm a licensed mental health therapist, and not going to go into both organizations just in terms of time, but my passion, I'm a person in long-term recovery, and my passion is bringing mental health and addiction together in one organization and providing people with integrated and easy to access support throughout the state. So the organization that I've been working on most recently is an intensive outpatient and partial hospitalization program, which is Insight Northwest Recovery here on the University of 12 to 29. I chose the OAC just as a continuation of my own experience as a person in recovery. I was fortunate enough to be able to get the opportunity to turn my life around at a pretty young age, at the age of 21. So being able to continue that and be a part of change and positive change in the world is a part of that. So thank you.
Thank you. Glad to have you here. Keisha.
Oops. Sorry. Hi. My pronouns are Black. And why did I choose the OAC? I chose the OAC because really I was against Measure 110, and I thought it would create a whole lot of chaos in my community. And so since it passed, I felt like I needed to be a part of shaping how it looks for us. Trying to read the questions too. So also, I'm a person with lived experience. I'm a person who's been impacted by the war on drugs. I caught my first felony 3 weeks after my 18th birthday, and it was a barrier and a hindrance for moving forward. Also, I worked in the addiction mental health field. I worked nonprofit, government, all around peer support, consumer voice, advocacy. And so hopefully I am doing my due diligence to my community to bring their voices to this table. And who influenced me? I would have to say some Gary Watson, some predecessors that came before me, Linda Clark,
Nature Gooden, who was part of helping start up LEAD in Seattle, and some more folks. Too many to name. And welcome to everyone new. Thank you.
Thank you, Keisha. Linda.
Hi everyone, I'm Linda. I'm an addiction medicine physician and researcher at OHSU and Hillsborough Medical Center. What brought me to this is really my patients and seeing what they're going through and all the barriers they have for accessing the treatment that they need. I also get to work with an interdisciplinary team with a peer and social worker and others in my work, and I've really appreciated having different perspectives and being on the OAC for the last maybe year-ish. It's just been really cool to hear everybody else's perspectives and passions. So, yeah, nice to be here with you all.
Thank you, Linda. Mason, welcome.
Hello, thanks for the welcome. Let's see here. Questions. My name is Mason Williams. They, them. Excuse me, sorry, looking at that. Why I choose the OAC is I am also a person with lived experience in addiction. High school dropout. I experienced a lot of chronic classroom insecurity for a long time. Justice involved. I got the opportunity a few years ago to start doing recovery peer support with a focus on young people and adolescents. I started using substances when I was very young, and then ended up having a lot of barriers. So I highly value low barrier, no barrier, grassroots DIY organizing, and involving people who are directly affected by by the decisions that we make. That's why the OAC was something I felt like I wanted to be a part of. And the people who most influenced me are the young people that I grew up with who did not abandon me while I was being actively self-destructive, and who were willing to call me out and still hold patience and space for me. A lot of those people aren't around anymore, but I consider them very much my inspiration and the reason I do this.
Mason, happy to have you here. Next up, we've got Ron.
Hello, hi everyone. I want to welcome the new folks. It's really great for you to be here. A couple familiar faces. I've interacted with Mason at least once in the past when I was down in Ashland doing a presentation. It's great to see all of you. Like I said, my name is Ron Williams. My pronouns are he, him, his. I've been involved with, I'm a community organizer. I've been involved in community organizing, particularly around recovery issues since 1999. We started an organization here called the Recovery Association Project in Portland. In 2002, I was one of the founders of the national organization Faces and Voices of Recovery. I went on to get a degree in political science from Portland State and was the executive director of a statewide political advocacy grassroots organization by the name of Oregon Action, where I ran that organization for many years, and it took a pause and worked in a bakery for a few years before being called to work on advocating for full, timely, and meaningful implementation of Measure 110. So we formed an organization here in Oregon back in 2020 called the Health Justice Recovery Alliance. I worked there for 4 years. We parted ways kind of at the end of the session last year, and I'm still actively and passionate and engaged in recovery advocacy and policy. strategy and community organizing relative to recovery issues. I'm a person in long-term recovery. I have also a criminal engagement, criminal history from 1995. So I have lived experience with both addiction and the criminal justice system, and I'm extremely passionate about ensuring that our voices lift up people in recovery and we are able to advocate through the use of funds for full and timely provision of services through this awesome awesome power that we have to be able to distribute funds. So that's me.
Awesome. Thank you, Ron. Ryan, you're up.
Hello, everybody. I'm Ryan Bear. My pronouns are he and him. I'm the CCO representative, and I have a doctorate in social work. I've been in the field for over 30 years now. I really believe in the original vision and purpose of Measure 110. I think that I'm a lifelong learner, and I'm learning in every meeting I attend with you all, and I very much appreciate that. I think I was greatly influenced in the early 90s by my county office manager when I asked him for additional resources. He said, if we had some ham, we could have a ham sandwich if we had some bread. And that's kind of my perspective when seeking resources in social services.
Thank you, Ryan. Sabrina. We can't hear you. Okay, good. Not yet? Not yet? You want me to come back to you? Okay, got you. That's the Zoom sign language. So the last two folks, we've got Hubert, who I think might be back, and Amy, who looks like she stepped away for a moment. There he is. Hey, Hubert.
Well, introductions.
Yep, for our new members.
Oh, I'm Hubert Matthews, and I've been with this council since the beginning. So I've been up here for over 10 years. I worked for Central City Concern. I worked with one of the programs called Going Home 2 for a while. Now I work with Providence Bob team. So I want to welcome all the new people. Welcome to the council. It's a big thing. It's a good thing to be able to help our communities with resources so we can help those suffering from substance use disorders and God knows what else, right? I really enjoy being on this council, I don't speak a whole lot. I don't put my opinion out there a whole lot, but I think that's going to change in 25, right? Because I think that I see some things that I think that we can do better and to be more effective, from my opinion, right? And that's what I got on this council to do. I think I need to do that a little bit more. I think my opinion matters, even though sometimes I feel like it doesn't. That's just my stuff, right? I don't know where that comes from because people think that I do matter, right? So I think that we're here. We need to get this work done, and we need to get it out, get the money out, and we have a lot of times to talk about what we think works, what don't work. But right now, we need to get this money out because yeah, we have a time frame here that's important, and it has to get done, So I just wanted to put that out there. Let's stick to the task today and let's get it done. You know, People need the money. All right. Thank you. I'm glad to be here.
Thank you, Hubert. Sabrina, let's do a mic check.
Can you hear me?
Yes, ma'am. We
Oh,
got
dear
you.
gosh. Okay, so my name is Sabrina Garcia, and I've been on the council since it very first started. I use she, her pronouns. I work for Transformations Wellness Center in Southern Oregon in a rural community. We offer the full spectrum of care from harm reduction to residential treatment, outpatient treatment, transitional housing. So we do the full spectrum of care. What are the other questions? I lost them in the chat. Okay, and then why I chose the OAC is because I have a voice of many different intersectionalities. I came from poverty. I used drugs and alcohol for 25 years of my life, starting at a very early age. I'm the first person in my family lineage that ever had employment or had a job. And out of my siblings, my immediate siblings, I'm the only one that's in recovery. I'm from a rural community. I'm a product or try to muddle through siloed systems. I've been in recovery for 7.5 years, and I'm an enrolled tribal member. Um, why I chose the OAC is because I was scared once I seen that it was actually coming to be a real thing. Once Measure 110 got approved, and I was thinking with that magnitude of money and that big of a systems change, I wanted to be a part of it, regardless of my experience prior. I had none. It's my first time ever doing something to this magnitude. And who influenced me the most? I'd say all of my fellow council members did. Prior to me being on my first meeting for OAC, I went and did a internet search and did a bio check of every single one of my council members. And so when I seen like the type of people that I'd be sitting on the council with, I was honored to say the less. And then also Ron Williams really stuck out to me a lot. He helped me, encourage me find my voice the first time sitting as a tri-chair, and just watching everybody and the way they do things just helped me raise my bar a little bit higher each time. So thank you and welcome to all the council members.
Thank you. Amy, okay, please go ahead.
Sorry, I just wanted to say thank you. And my preferred pronouns are, I hope I do it right, she, her. I chose OAC because of we have a lot of people out here in Eastern Oregon that are overdosing, and they seem to be family members, and it's really irritating. And I'm going to go to a viewing right now for another loss of life. And this little girl right here is why I do OAC. Matter of fact, our first meeting, I was in the hospital with her, holding her when we first started all this. And I've never felt more passionate about anything I've ever done in my life. We have an amazing group. We've had an amazing group. All the new people come in. I'm excited as well. And it's been my honor to serve on here. Man, who's influenced me the most? Onisha, she's not, I don't think she's here right now, but Onisha was Ron's been freaking amazing. Man, smart, kind. We've all had learning curves too, you know, and just watching everybody grow like Sabrina and come out of her shell and start talking more and getting more into it. And, you know, we all learn different things serving in here. And I think one of my deepest passions though right now is we got to stop the youth from dying. This young lady was under 30 years old. And so just irritated right now with the whole thing. But I am going to step over to the viewing and I'm going to come back. But I really thank you for letting me speak right now from my heart. I'm really excited about this. And, you know, they're not going to be able to stop the progress that we have set into motion. You know, we just have to remember that there's many personalities. And one thing that's going to leave with this, I always say principles before personalities. Got to keep your principles straight. Got to keep your aura about you. And remember that everybody's got some form of connection to be here. And for that reason, we do what we do. So bless you all. And I'm running next door to the viewing.
Thank you, Amy. Appreciate you. And Leticia, hi.
Hi. Sorry I was late. So it looks like we're doing introductions. My name is Leticia Welch. My preferred pronouns are she, her. I live in Southern Oregon, um, and I chose the OAC because of my own personal experience with addiction and recovery, and just looking back at all of the barriers that I faced, and the many attempts that I had at trying to get clean. So really excited and humbled to be a part of this process. And then I've had many people, greatly influence me when it comes to the OAC, and I feel very passionately about it. I know that one of the first people that really influenced me a lot was Ron Williams, and so I really appreciate you, Ron, Sabrina, and Carlos. Thank you.
Great, thank you. Okay, Carly confirmed we are at quorum. Before I jump into the business of the day, are there any questions or comments before I start? Okay. I'm going to do a little bit of a slideshow, so bear with me because screen sharing is fun and sometimes daunting. All right. Hopefully you're seeing a little blue and orange journey. All right, so just to make sure we're all together on the same page before we jump into our funding decisions today. On October 4th, the application period for the request for grant applications, the RFGA, closed. When all was said and done, 331 applications were submitted by partners across the state to use DTRSF, or Drug Treatment Recovery Services funds, to be a part of a BHRN, a Behavioral Health Resource Network, in counties and communities across the state. Of the 331 applications that were submitted, 317 passed a minimum screening requirement. Basically, did you complete all the parts? Did you have all the attachments in the right format? And we gave people time if there were anything missing to do any correction. So 317 was the number of applications we processed. And then some OAC members and OHA staff all came together to learn how to review and score these applications. Each application had 2 independent reviews, and the applications were scored and compiled and returned back to our contracting office, who then took all the information and built a bunch of files for us and then gave it to the Measure 110 team. What the reviewers were really paying attention to were the scores. So each application had a bunch of questions, and the questions were ranked, and I ranked a few as well, scored a few as well. Each question was given a score of 0, 1, or 2. Basically, did they answer the question fully or not? There were multiple budget requests. And there are 6 service areas, and we'll go through this many, many times over as we go through each of the applications and counties. Each burn has 6 different service areas. It's screenings and assessments, SUD services and treatment, peer services, housing, and harm reduction. So we have to make sure that every county has all of those 6 service areas covered in some shape or form. We also wanted to make sure that those services that are being provided, whenever possible, are culturally and linguistically specific. That is not only a stated value and goal of the OAC, but it's also in legislation. And we also flagged applications that were able to provide specific expertise in trauma-informed care, gender-affirming care, services for folks with intellectual or developmental disabilities, and other folks who are often underserved. So that is 600 and almost 50 applications, reviews that were then culled and organized. And then what is required by law is the reviewers have to come together at what's called a review panel and talk about all of the applications and make funding recommendations to the Oversight and Accountability Council. So for example, County A had 6 applications. This is what our scores were. Here is a funding recommendation that meets the formula, and I'll talk about the formula in a minute, that you all, the OAC, voted to use in October. And again, I'll go into that a little bit more. And so we are in the middle of still doing panel reviews. I spend a lot of hours with Ron and Keisha and Carly in these meetings. I'm really appreciating everybody's participation to get through all of them. But we have gotten through 28 of 36 counties. So what part of what you'll see today are those recommendations as well. Any questions about this so far? Please feel free to ask. Okay. Interrupt me anytime. So I mentioned the formula, and I know this is really small and ugly, but in through the summer and then October 9th, the OAC voted to use this formula as a guideline. And what you'll see here is on the left-hand side, each of Oregon's 36 counties, the 2020 census population, a base starting point, and you'll see that for extra large counties like Multnomah, Washington, Clackamas, and Lane, the base is $5 million, and then the base begins to go down based on size. So large counties, the base is 4 million, medium is 3 million, small is 2 million. And then there are these other factors, the burden of disease, homelessness count, Medicaid population overdose, emergency department only visits, arrests, and drug overdose deaths were calculated to come up with the total in the yellow column that you see on the right. And as the review panel received, reviewed, and discussed all of the county's applications, they tried to get those recommendations within that ballpark in that number. I'm not going to use Multnomah County as an example because we haven't done it yet. We have, however, done Clackamas County. Clackamas County's formula, CAP, you'll hear CAP, you'll hear formula, you'll hear, those are pretty much the only words we've been using, but is that $21,937,000. You don't need to memorize that, but just so you know, the recommendations coming to you, because the OAC voted, need to be around that amount. So that's the structure that these decision-making processes have been happening within. Any questions so far? Okay. So the OAC did vote on one county. Baker County got approved. That got approved about 2 weeks ago. And that got approved because that was actually a very, very simple county. If you recall, it was 2 applicants. It was about at the formula, good to go. And then what happened is we jumped into Baker County and it blew all of the socks off because Benton County had a lot of applicants. It was way over the formula amount, and the decisions just got really intractable and too hard to make and too complex. And so for that reason, we have spent the last meeting or two having OHA, I guess that would be me, asking you all as the OAC members and deciders, what is most important to you? What do you want to see? What do you want us to prioritize to really help facilitate and ease your decision-making process? And so the information we're going to share with you today, the context is that first we wanted to uplift all of your priorities, and I'll make sure to review those that you've discussed over the past 2 weeks. To remind folks that if an applicant, these are made up numbers, applies for $10 million and the final recommendation is at $5 million, you all have stated that you would like OHA to go back to the provider and say, hey, $10 million applicant, we'd love to fund you, but we can't. There's not enough money. We have $5 million. What's the best way for you to use those dollars to still do some service? Tell us how many people you can serve. So we are you've told us there are reductions you want us to calculate, but also for us to work with providers to figure out how to make that work within their own budgets. We'll talk more about that in a bit. And what I put in italics here in the bottom, I just keep thinking about soup. You know, how thin do you want the soup to get? So, ideally we want each applicant that, is culturally specific and showing up for the values and the core of the OAC to get like the heartiest, most amazing soup ever, with all of the protein and the vegetables and all of the things. At what point is it not enough to be a feasible award? What point does the soup get too thin? This morning I used to joke about, I love a good powdered chicken bouillon, but it's not, that's not like a good stew. And so if you see someone with a $9 million ask and we can only give them 100 and, 1.5 million, thank you for entertaining that. I'm just trying to get us all on the same page before we dive into these hard conversations. There were 4 charts that we prepared for you. One is what we're calling home base. It is the summary of all of the applicants for the entire county. So you get to see all of it. And many thanks to Carly for emailing them all to you because it's a lot. I know it's a lot. And Leticia, I hope we figured out your tech difficulties and you were oh, good. I'm glad you were able to open them because you all need to have access to that to really answer your own questions and curiosities about what the applicant is actually saying. And I want to remind folks that our job as the staff is to reflect on what is in the application and what is in the application only. So we're not bringing in outside opinions or perspectives or data. So if you have specific questions, the application is there for you to look at as well. The second chart will be the panel review recommendations. So what the panelists discussed and deliberated, and if you watch any of those meetings, there's a lot of deliberation about what those recommendations are. You can take them or you can leave them. What I want to flag for you right now is that the panel review meetings have begun long before you all voted to prioritize existing grantees, people who currently are part of a burn and have reapplied, and providers who are culturally specific. As soon as you made that vote, the review panel pivoted to uplift that value. So the first few counties we'll go through, you'll see a lot of difference between what the review panel recommended and number 3, which is your priorities. So at the last meeting, y'all had a motion and voted, I believe, Morgan, hi Morgan, Morgan's here, began the motion. And basically y'all assigned that OHA go back and look at each county and that you wanted prioritized the list on the right. Current grantees, so people who are in the burn now and are reapplying, folks who provide culturally specific services, gender affirming services, services that are not billable to Medicaid. Oh, sorry, that's a typo. That should say 4 new applicants, no expansion of service areas. Sorry, for new, I apologize for the typo. That's my fault. No expansion of service areas. I think Keisha brought that up last week and there was some alignment with that if an organization is just providing housing, that if they're asking for a whole lot more to do peers and to do harm reduction, that you want the core services to remain intact and that anything extra might be considered for reduction. That you wanted to prioritize direct client services over administration or other personnel that do not directly serve clients. You also asked that we take a look at a reduction for small, medium, and large counties. And the reason I went over the formula is because that is actually part of the formula in that base amount. So in some of what you'll see coming up is your priorities reflected in a cap. So for a small county, an award would be capped at 2 million. For a medium county, that award would be capped at 3 million. And if we're still over, because there are counties that have asked 300 times the amount of the money available, then we offered additional decreases and you voted to see a 70% reduction across the board. So we prepared all of that for you. So we did all of the legwork and all of the mathing And we'll present that to you today. And the fourth chart I thought would be important to show you for your consideration is just funding existing partners. And if by the end of a discussion, it's just you're at a bit of a stalemate and it's just not like there's a motion there to move it forward, you can always kick it back to OHA and just tell us what partners you want to fund, and we'll figure out some of the final numbers through negotiations. This is a lot. I want to pause and see if anybody has any questions. I've tried to be as communicative as possible, and it's just like, it's so complex, and I spend like 10 hours a day on this stuff. And so I just own the fact that these are my weeds and they may not be yours. And so however you need to ask questions or get clarity, please do so. I am more than happy to chat more about this. My goal was to do the legwork for you to help ease your decisions. Okay. The last thing I want to share with you is color coding. We try to use consistent colors throughout. When you see a bright yellow, that is usually the total. And in these upcoming charts, that's going to often be the county formula. You saw it in bright yellow on the formula, like this is the number we're trying to get to. We so wish these decisions were not money driven and that they were need driven and we could just meet the need, but unfortunately, it's green. That's because both reviewers like, yep, we recommend it. If it's blue, one of the two reviewers recommended it. And if it's orange, neither of the reviewers recommended it. But I'll have you know that the reviewers didn't look at each application in context of the whole county. They just looked at one application. And again, if needed, we can go back and do some negotiations. But I hope the preparation we did sets us up for a good conversation today. Okay, I'm going to stop sharing for a minute. Really sick of my own voice. I'm sorry for that. Any comments or questions before we dive into our first county for today? Great, Caroline.
I thought that was an excellent overview. So I'm visual. So the slides really did it for me. So really good job, Abby.
No questions? Great. I'm done. Thanks, Caroline. Ron, my panel review partner, please.
Yeah, I just wanted to thank you. That was a great presentation. I agree entirely with Caroline. I just wanted, I don't know if the new people are aware of the kind of the mechanics of how the review process worked in terms of 2 reviewers, 300 plus applications. There have been, so it's like 600 reviews. Those reviews would take 2 to 3 hours per application to do an evaluation. The reviewers then came to the review panel and did very in-depth and detailed presentations. The scores and the commentary was discussed in detail thoroughly by the review panel, and those evaluations were then debated enthusiastically. The numbers of the numbers for the organizations and for the counties were fine-tuned financially to provide the best recommendation, with comments and concerns to come to the council for consideration and deliberation. But I just wanted folks to know that a lot has gone into this process leading up to here. And so our goal is to move forward with these recommendations so that we can move them to the next phase, not to relitigate the evaluation process. And I just wanted to be clear about that for folks who are just coming on who may have that instinct. That's what I wanted to say.
Appreciate you, Ron. Yes, there's a lot of negotiations that happen in that panel review. Keisha, please.
Yeah, there was a lot of negotiations that went to the panel review. It's been a taxing, strenuous process. but still lean to your understanding to ask questions about things. Some of the ones we reviewed, we didn't review with the lens of the priorities we have now. So it might, we might have to do some fine tuning. But yeah, and thank you for that overview. That was amazing. Abby, sorry, I've been walking up and downstairs.
Keisha, I hope that we did enough legwork that we provided options that uplift your votes, even though the panel review had already started meeting. Hunter, in 1 sec, let me just quickly answer Mason's question in the chat. Is that there were, I think, almost 30 reviewers at this point. I can't remember, high 20s. And there were like 6 OAC reviewers and the rest were OHA staff. And we were all assigned applications to go review and by ourselves. It took about 2 hours per application, or 3 Ron if it was complex. And then all of the reviewers came back together to have these public meetings. And you can watch them all if you'd like. There's dozens of hours of meetings for you to enjoy. And so that is all a very transparent public process. So anybody who reviewed anything came back together. Great. Hunter, go ahead.
I just want to say, and quickly in for time, I have hope. I have hope. After all of this leading up to this, and those slides were excellent, and I feel like we're kind of all more on the same page than we've been in a while, and I have hope.
And I have optimism. Let's do this. So Dharma, with her wisdom, suggested we dive into not a massive unwieldy county. So we're going to start with a winner. I mean, they're all winners, but we're going to not dive into Clackamas and Benton. We're going to start with Clatsop County. So are there any last questions or comments before I share screen? And it's just a spreadsheet. It ain't pretty, but I think it's going to work. Okay. And please know, I can see all of you. So if I see your body language like what, I will call on you. I want to make sure I'm catching everything that y'all need to make sure that this is a well-informed, thoughtful process. Okay. Oh, Ami.
Hi, y'all. I know I'm new. I'm trying to sit back and just observe because it's a lot of information to take in, and it's a lot to step in during application process. But I just wanted to know what falls under culturally specific, because I hear that a lot, and I feel like people have different meanings.
Yep.
When it comes to that. So
Yep, thank you. I thank you for the segue. That was the first thing I was going to share when I got into this to Clatsop County. So from a state perspective, when we receive the applications, question 7 says, do you provide culturally specific or linguistically specific services? And we take what the applicant says as their truth. So some people say no, and some people say yes. And other people say things like, we have a translation service. We translate our materials into different languages. We refer to culturally to other organizations. We're working to hiring bilingual, bicultural staff. So that's why we sent you all the applications. And if you really want to go deep, what you do is open the project scope inside of the folder, and it's question 7. And so what we did, and thank you for reminding me to reiterate this, we as the state needed to reflect what's in the application, and y'all can take that conversation to the places you need to take it, but that is what you're going to see is what the applicant indicated on their application.
Thank you.
Yep. Great. Okay. And away we go. I'm going to do a time check. We have 2 hours. And we'll see how Clatsop County goes. My goal, and we have a deadline, February 21st. So the, thoughtful and quick at the same time, not only, a little oil and water, but I think we can shake it up and make it work. Okay. How's the size? Do I need to zoom in? Especially if you're on your phone. Okay. Zooming in. All right. Better? And also you should have like 3 dots next to Abby Stamp sharing, and that should like allow you to make your side of the thing bigger on the Zoom dealio too. Okay. I'm going to take a couple of slow minutes to go through CLATSUP. So because this is the first one, right? And then it'll become easier. So Carly.
Just a reminder about call for conflicts.
Oh, goodness. Thank you so much. You're so good. Seriously. Carly, in all of her wisdom, helps us not forget anything we need to forget. So before I start with Clatsop County, I do need to do a call for conflicts. And that means if you have an actual or potential conflict of interest with any of the providers listed here, you need to let us know immediately so that we're aware of that. Thank you, Shannon, for your information. And so an actual conflict of interest is like, oh yeah, I'm on the board there, or my daughter was a client there, you know, an actual like real financial conflict of interest, or a potential is like, I'm not sure, either needs to be voiced. So the applicants for Clatsop County are Boulder Care Provider Group, Clatsop Behavioral Health Care, Clatsop Community Action, Clatsop County, Helping Hands Reentry Outreach Centers, Iron Tribe Network, Lifeboat Services, and Providence Seaside Hospital. Are there any actual or potential conflicts of interest in Clatsop County for these providers? And if there are, it's totally fine. We have directions on how to manage that. Okay, I'm going to proceed. So what we've got here first, entity is simply the provider name. Reviewer score 1 is the total score that the reviewer gave the application on a scale of 0 to 30. Reviewer score 2 is the other scores score. Screening, if, again, back to the color scheme, if it's blue, one of the two reviewers recommended, green is both, and orange is neither. And so what you'll see on the chart is these 6 service areas I noted, which are screening, assessment, substance use, peer support, housing, and harm reduction. These are the amounts that each of the provider put in their application to provide the service. And they indicated how many people they would be serving, and they indicated whether the staff was for CADCs or other direct staff, whether it's for support staff or data, and anyway. So if it's gray, they didn't apply for it. Some of these, so you'll see here in Clatsop Behavioral Healthcare, for example, there's colors but no numbers. Sometimes what an applicant did was actually put all of their costs into this column here, which are program costs. So if you opened up a budget, you could actually look and go check out Clatsop Behavioral Healthcare's budget, and you'll see that they're indicating they want to provide all the services, but not how much each of them would cost. So we can't go back and ask people questions. So we're just giving you all of the information we've got. And so you see the program costs at $3.874 million are to do all of those services. If we want more information, it would have to be later on that we chat with them. Any questions so far? Cool. Okay. The total is just the total application across the board. You're going to start to see the acronym NTE, which is not to exceed, which is basically here's your entire grant for all the stuff you want to do. Don't spend more than that. The weight, we don't have Zeb here to help describe this, but when we started reviewing applications and we got to counties that had dozens of applications and they were all great, it became really hard to pull them apart to see the differences. And so the weight is the inclusion of, at that point, the biggest priorities of the OAC, which included culturally and linguistically specific services, serving underserved communities, which includes doing trauma-informed care, gender affirming, all of the things we just talked about, and then providing services that are not billable to Medicaid or other health insurance, or providing services for folks who are under or uninsured. So not supplanting Medicaid or other insurance. And so those questions, so the weight is on a scale of 0 to 12. And what I want to be really clear about is if someone answered the question really, really fully, they they answered all of the pieces of the question, they got a 2. They answered half of it, they got a 1, and they didn't really answer it, they got a 0. So what that indicates is how detailed the question was, not whether the answer was fully in alignment with A, B, and C or part of the burn. It really was about the level of a completion. It's like showing your work in long division, but maybe not quite getting the answer right. So what we wanted to do was to be able to show the weighted score just as a way to help stratify or like pull out when there's so many applications that started to look the same. This has nothing to do with the score of the application, the value of the services, but I wanted to make sure you know that this was something we talked about sometimes. Okay, so this is chart one. This is home base. I'm going to move on to the next one. Here, oh, sorry, one more thing. The cap, the formula for Clatsop County is just under $9 million, $8.9 million. So this is what the panel review recommended. And again, this is before you voted to prioritize existing grantees and corporally specific services. So, oh, and if I failed to mention, if the applicant, if the entity name is in orange, they are a current grantee and they are seeking funds to continue their services or add. So all of this is duplicated. Same deal, all of the same numbers here. And then the panel review would sometimes make financial or funding recommendations. So specifically in this county, they went, we need to make a cap. This is too much money. So although this ask for Cascade for Clatsop Behavioral Health Care was $3.8 million, we put a cap at $2 million because there simply wasn't enough money to go around. So you add up the different totals, nothing over $2 million because that was the ceiling. And what you got was a total of $8.5 million, which is below the formula and something that could be easily moved forward. And if there are questions in the chat for me, I am unable. I got a lot of windows going and I'm not tracking it very well. So please just unmute and chime in if you have questions that you need me to stop and talk with now. But you'll see that some of the numbers here, the reviewer scores and the weight score, they're higher. The weight is on a 0 to 12, the reviewer score is 0 to 30. So they were really robust applications. But recall, this was before your vote. That is chart 2. Moving on to chart 3. All of your priorities, everything you said go do, we went and we did it. So what you've got are the 5 existing grantees, the 5 existing grants: Clatsop Behavioral Healthcare, Clatsop Community Action, Clatsop County, Helping Hands, Iron Tribe, and the new applicant, Providence Seaside Hospital, because they indicated they were culturally specific, and you said you wanted to prioritize new and culturally specific, so we made sure that they were included. You also asked us to remove funds that were the indirect. So every applicant got to add another 10% for indirect costs, which could, just the money it takes to do a program. It could be anything from rent to taxes to whatever it takes. We took all of that out. And we also went into every budget, into every area, and took out any staff that was not direct services. So we took out support staff, we took out the director staff, we took out manager staff, unless it's clinical manager or clinical supervisor, because that's required for CADCs and other direct service providers. We left in things like cars and gas, because so many of the peer outreach programs require cars and gas to go do their work. But everything else we took out because you asked us to. So this is like the total minus the admin. The expansion is when an applicant applied for service areas they are not currently providing, and we took that out. And then you've got the totals, and the totals is always within that $2 million cap because that is what you voted into consideration. And here's my notes. Just to kind of keep us organized there. And last but not least, chart 4 is existing providers. So if y'all just wanted to go with the existing providers, here are the 5 burn partners that are the burn in Clatsop County. And going over to the right here, excuse me. In order to keep it within the formula amount, you would not need to take out any admin or indirect. You would not need to take out service expansion, but you would still need to consider some sort of cap to keep it in the formula amount. And I'll try to do this, like look at the difference between 3.78 and 2 million, $4.4 million and $2 million. So sometimes folks are, it's a big hit. It's a big hit. And I'll just say it again, it's not because we want to do that. It's because there's not enough cannabis revenue to go around this time. So this is everything. So each county will look like this. And my question to you all, I would love to hear which one makes your heart sing? Which one gives you the least amount of heartache? How about let's flip that around in terms of the panel review recommendations, which does eliminate one of the existing providers, your priorities with a big kind of a cut, or just existing providers with a little bit less of a cut. Please ask me questions. Tell me what you think. Dharma.
I was just wondering if we could get some advice on the program cost. I guess I hadn't thought that like we would cut their 10% indirect. I was wondering if that's a required component, like they have to have some percentage of indirect costs that we have to keep up for contracts.
So let me repeat what I said earlier. This is really hard for me to articulate, and I apologize for that. So let's say I'm sorry, class of behavioral health care, but you're our example today. Let's say they need $3.8 million to do what they want to do, but they're getting 2 million. Your discussion of late has not been, we're going to tell them exactly what they need to cut, and they can't charge indirect, and they can't do admin, and they can't do this, that, or the other. It is simply, this is your new budget.
Got you.
What can you do within it?
Okay.
So it's a way of calculating a new NTE without prescribing it. So it's a little funky.
That makes sense.
Okay. Sabrina.
So I just want to make sure I understood that last part. So we're giving them a different budget amount, and then they can work whatever is pliable to their organization under that budget amount. And so I heard you say something about managers, but what about like a peer manager? If they were able to get that under the amount, then that would be permissible.
I think people can do whatever they need to as long as they serve the service areas that are required. Yeah. Morgan?
What does NTE stand for?
Sorry, not to exceed. That was the first thing I learned on my first day in this job. Like, what is that? So that's basically the total amount. Don't spend more than you got. Yeah. So I'm gonna, any other questions about this methodology or process before someone says, you know what, I like option, and then we'll discuss. Linda.
Quick question. I'm so sorry if I missed it in all the emails. Can I pull this spreadsheet up somewhere so I can?
No, I can send it out. I mean, we've been working on it like today. So I didn't have it ready in time. But yeah, we can get this out.
Okay, that'd be great. Thank you.
Carly, let me make sure you have access to Kathy's here, Jason's here. Can you share the spreadsheet with Carly and she can send it out as a PDF? Thank you, please, and thank you. And I know it's not perfect because it's a lot. So, Ron.
So just in terms of, if I could see the council priorities.
This one?
Yeah, so the council priorities is within budget, but it excludes a previously funded entity. Is that correct?
No, it does not. Sorry, I'm probably making you guys nauseous. It does not eliminate any existing grantee at all. What it does is lowers the dollar amounts. So this is what you want to be looking at.
Okay, all right. But all of the previously funded partners are there, and all of the council's priorities are present in this budget, and it is within the formula.
It is. It's way under the formula. It's just your priorities are there. It's just a lot less money to do the work. So we would need to negotiate with the providers about what that would look like. But yes.
Thank you.
Hunter?
So this one that we're referring to, the one that Ron was asking about, it also not only does it adhere to our priorities, but it also adds Providence Seaside as well, correct?
And that's because they indicated they provided culturally specific services in their application.
Yeah, which is like, I think, I can't only speak for everybody, but we didn't want to exclude previous burn partners. We didn't want to close down people that we stood up. But if there was room, I know that Morgan thought it was really important to get new places out there, and so my initial thoughts are I'm really liking the middle one. I just wanted to throw that out there for everyone.
Great. Thank you, Hunter. Mason.
Okay, thank you. And forgive me if I'm misunderstanding this, but if I understood correctly, the Clatsop County cap was 8.9, and then in the second, in the council values one that everybody's talking about right now is 7.8, 7.9-ish. Is there a process so that like the remaining million is like not left on the table, as it were?
Absolutely. You guys could say, we don't want that $2 million cap, or we don't want you to take out indirect. And we could do live math together and see what that looks like, if that's something you would like. Hunter, is your hand back up? Yeah, go ahead.
Yeah, and that was my next thought is since there's money left over, if we were to go with this one, how would we split that up, right? Would that be divvied evenly between? Would yeah, and I'm wondering what the rest of the council thinks about that.
Morgan, what do you think about that?
Yeah, I was going to ask if OHA had any proposals for us to get back to the allotment there.
Yeah. I would recommend going back with their indirect and admin as much as possible, just knowing what it takes to run program. You all know what it takes to run programs. Would you like me to do some of that math on the side while you're chatting? Okay,
Yes,
this is going to be an
please.
experiment, but Ron, go ahead, please.
Yes, that sounds fine. But I guess what I was gonna ask, if we were to just move this, we wouldn't lose the money. It would just be part of the negotiations, would it not?
Yep, you could say, we're going to vote on, I should have labeled these a thing, but we're going to call this option 3 for Clatsop. And we want OHA to go back in there and to, bring the amounts equitably back up to the formula amount.
Within the negotiation process with the burn partners.
So two things, yes, within all of this will need to be negotiated because they're all about cuts.
That's
Yeah, I
exactly
see.
right. That's why I'm suggesting it.
I got you. And I see Jason's in there. Are you going to do math for me? We'll see. Dharma, go ahead.
I'm a little bit concerned about that last piece. In the past, I guess we've been advised that like we needed to delegate the specific amounts to the providers. That in the end, if it was left in negotiations and it wasn't attributed to them, that it would go back into the general pool of funds, not the county specifically. And that's my concern, is that we would need to apply them to them specifically. So I think that we should do the math and add them back into their indirect or whatever, as
Yep.
opposed to just leaving it in negotiations, because then it could go back into the pool and not to the county that we thought it was going to go to.
And one of the things I'll note as I'm having a hard time facilitating and contributing and doing math on the same side, but what I'm seeing over here is that the first two applicants took almost a 50% cut. I would probably prioritize bringing them back up, since the other, well, they're all kind of significant. Most of them are, but I would probably want to do it proportionally based on how much the reduction was. So I'll play with that a little bit on the side. Keish, go ahead.
Yeah, it's kind of hard. The way the screen is toggling to see what organization is what, and the cut. Did they all take the same cut or different?
That's up for you to decide, unless you want to
No,
delegate
I'm
that.
I'm just trying to look at the graph that's
Yeah.
on the screen and figure out
Here.
what happened.
you know what I'm going to do? I'm going to try to make these a little smaller and see if we can't get everything on the same screen. You guys have a lot of priorities. It took a lot of columns to show it all. So I'm going to go ahead and do it this way maybe and keep it, is that a little bit better? So you've got, you know, the name over here. Yeah, cool, cool. All right. Sabrina.
Yeah, I had a question. So I thought prior in the previous negotiations that there, whatever money was left over, I think we made it a priority to like, I'm just going to use Multnomah for an example, because I know they had a large lump of money left over last time that they turned it back into the county. And I'm just guessing, I'm just going to make this as an example because I'm not sure. Say that housing was a priority. So they took X amount of money and distributed against all the burn approved partners for housing. So I'm wondering this time with negotiations or prior to negotiations, if there's a large lump sum of money left over, how are we going to delegate that? I like what Ron was saying, or what I thought I heard him saying, that we'll say, yes, we approve this, this, and this, and then whatever that large little chunk is, that they could figure it out at negotiations. But I also like what you said about the admin cost.
I want to make sure that every single dollar is put out to the community, right? So my goal is to get to the formula and like be good with it. So I apologize, but I'm just trying to do a little bit of math here. And we got hands going back up. Keisha, is that a new hand?
Yeah, I'm just wondering, did we figure out who are, and I might have missed it, but did you explain about the CMHPs?
No. Do you want to, could you explain what the panel review is discussing? Or do you
Take it on.
Okay. Hold on one sec,
No,
Keisha.
so no, I will.
Okay.
So like in the panel review, something that we look at as CMHPs, meaning they're the community mental local health authority. So they have different blended funding, they get different pots of money. And so when we are prioritizing organizations, we're kind of looking at who can't bill Medicaid and who cannot, who don't have other sources of funds. And so in the review panel, we have been kind of cutting more money from those who can bill Medicaid, who is the CMHP, and can retrieve them dollars other ways. And then we put the remaining in local organizations, nonprofits, culturally specific organizations who really don't have the ability to bill or get other types of funding.
Thanks, Keisha. And while just to let you know, I just did this really ugly math below here. If you brought the two organizations that got those significant cuts back up to 2,500,000, so added $500,000 back, that would get just about right to formula amount if you wanted to do that.
So are those two organizations, are they CMHPs or no?
I'd need to look. I think Class of Behavioral Healthcare is, but need to verify that.
Yeah, I would want to look before we put the money back there and not with some of the smaller orgs.
Sabrina?
Yeah, I just wanted to ask two questions. Did I hear you say that you wanted to try to, in real time, do all the financial up to the last dollar live?
I think that we can, what I would love to hear from you is what you want to recommend. What I'm hearing is you like this chart the best. What do you want to do to bring that to the formula amount? Which provider would you like to give a little bit more money to get us to $9 million?
I like the idea of admin costs, but I heard you say that you're going to add $500 to the $500,000 to the other organizations, even though they got a cut in the beginning to kind of get them back to where they were at. And I was
That's
just
an
wondering,
option.
yeah, I was just wondering the thinking behind that, just because kind of looks like we'd be prioritizing them over the other organizations. And so I just want to make sure I understand as we move forward.
Yeah, they just got the biggest cut to start. That's all. That's the only reason why. I need some help from my team. Jason, can you help with some math on the fly as questions come up? And Kathy, do you have the list of CMHPs in every county available so we can answer that for folks? I'd like to try to usher us into a decision soon for CLATSA.
I do, and I put it in the chat that Class of Behavioral Health is the CMHP.
Is the CMHP. Okay. Thank you for that. So that organization then has other resources, not specific to these dollars, but Ron, go ahead.
No, I want you to have some help too, because if we could get these numbers right, we might be able to move this.
Okay.
I can help with math, but I was trying to share the sheet and help do other things in the background, so I don't know what math you're asking for.
I know. I don't know what math I'm asking for either, but I like knowing you're on deck when I need it. What we're trying to do right now is get the total here in column O back up to closer to 9 million. So bring it up another $1 million because we want to use all the funds available in Clatsop County and thinking about the best way to do it. Let me ask you this about your priorities. What is most important to you? Because one of the things here is this expansion. These two applicants, Iron Tribe and Clatsop County, both asked for service area increases, but you asked to not have that as an option. That is something that you might want to consider adding back and ensuring that Iron Tribe can do peer support and housing. They used to do just housing, I think. And then Clatsop County, who's applying for both SUD and harm reduction. And I would like to say that that's the only other organization that asking for SUD dollars in addition to the CMHP. Dharma?
I was going to ask about that last point you just made about who is providing services beyond the CMHP. So I'm wondering though if we just put them back into the we're not I guess I would just err against going against the top cuts because that would I feel like do what Sabrina was saying and thinking about it more. But I just don't think that we should focus on that just because they're the largest cuts, but because it is the service provider for SUD and assessment, the only one for assessment too, that would make sense for me, and it would be the most direct towards direct services if we reoriented the remainder there.
Back to the CMHP?
Oh, wait, I'm sorry.
So Clatsop Behavioral Healthcare is the CMHP for Clatsop County. And you have concern that we reduce it too far, then that compromises assessments?
No,
because
you
it's the
were
only provider?
you're right. Sorry. So the expansion feels okay on Clatsop County.
So Clatsop County, I don't remember what they applied for last year because I don't have their application up to know if it was SUD or harm reduction. But I'm not the decider here, but I think it would be great for the residents of Clatsop County to have more than one burn providing SUD than the CMHP.
Yeah.
I'm going to take this out. Oh, Jason's already there doing it. See, it's like magic. Thank you, Jason. And we're going to go to Hunter.
Okay. What if we added the expansion back in that helps Iron Tribe have peer support, that helps Clatsop County also have SUD, so it's not only one SUD provider in the burn for the county. The rest, I mean, of course these numbers aren't right, but the other $500,000, give or take, split evenly for admin or whatever other cost among the rest of the agencies asking for money, maybe possibly less the CMHP. So expansion is still there. SUDs there's two providers in the county. Iron Tribe has peer support in their houses. The other agencies have something for admin, except for the CMHP, because of course they're a big entity. They have that funding coming from other places as well, and they've got that mental health piece, which we are for. But this is primarily substance use or substance use specific dollars. That's an idea I wanted to throw out there.
Beautiful. And Jason, I so appreciate you. Thank you. So what Jason just did is do the math of that. And you'll see the new total is 8.4.
I don't
which
know
is
if I caught. Sorry, I all I did
Mhm.
so far is add back in the expansion. I'm not sure. I was doing math while Hunter was speaking, so I'm not sure I caught everything Hunter said. I do apologize.
Can I go ahead?
Yeah, please go ahead.
So the remainder from the 8.4 to the 8.9 would be evenly for admin costs or what have you among the other agencies, except for the CMHP, which is I can't see it now, but Clatsop Behavioral Healthcare.
So splitting $500,000-ish equally between Clatsop Community Action, Clatsop County Helping Hands, Iron Tribe, and Providence.
It's 5 agencies. They each get $100,000, give or take, as well.
Love some easy math too. Okay. Couple of hands, and then we're going to talk about this just a bit more. I'm going over here to see we can see Jason do his work and take out my ugly math. Sorry, this is clearly not my strength. Keisha, go ahead.
Yeah, that's making sense. I was just a little leery on that when we say admin costs because it's different for each organization. So, but when you give an even number, different from saying admin costs because that can vary and get tricky.
It can vary, but I went into every budget and pulled out what you all have deemed as admin. So it's specific to
Getting split up between the folks who did not receive back expansion dollars?
No, I
Or
was
just
thinking just evenly amongst
okay. Thank you.
everyone but that CMHP.
Sounds good to me.
this is great. Fantastic. I'm feeling consensus. We'll see if it's there. But Jason, thank you. Y'all see the little pink dots bouncing around? It's Jason working. Right, Carly, thanks for the timer. Look at that. That's I'm going to Jason, thank you so much. Thank yous. Okay, so here we go. This is let me see, 1, 2, 3. Then we're going to call this option 3. This is the OAC priorities. All right. This is the summary. Dharma.
I was just gonna make a motion to approve option 3 on the formulas as shown on the screen.
Second.
Ron seconds. Sabrina smiling. Discussion. Hunter?
I have nothing to discuss.
Carly, will you take a vote?
Ami, how do you vote? Ami, if you're not able
Do it in the
to.
chat.
Okay, got it. Amy, are you back? Caroline?
Yes.
Dharma?
Yes.
Hubert?
Yes.
Hunter?
Yes.
Jackie? Josh, I think he's stepped out. Keisha?
Yes.
Leticia?
Yes.
Linda?
Yes.
Mason?
Yes.
Morgan?
Yes.
Ron?
Yes.
Brian?
Yes.
Sabrina?
Yes.
That passes with 12.
Beautiful job. Dharma.
I'm just wondering in advance for future decisions, can we use that same kind of thought process to kind of streamline things as well? Since that seems like we had strong consensus on that approach. If we could use that to queue that up for the suggestions. I don't think we're gonna get through everything today, but the ones that we can have preparation for, could we do that?
Yeah, can you be a little more specific? What do you mean? Which part of it
So
was?
our rationale for for getting it back up to the budget, the cap.
Yes. Yep.
Yeah. Okay.
Okay. Hunter?
Yeah, I think that's a good idea. I think, of course, this was a quote unquote easier county, but I like the consensus that we came to. I think that Dharma's has a good idea. She's on track with what I'm thinking as well.
Beautiful. Ron?
And the other part of it was that it was council priorities, existing providers, with limited expansion services. So as we're presenting, like maybe that's the one we look at, because I think it would streamline.
I am required to give you the panel review recommendations, but you can look at them and.
I have to say, right.
Okay,
I mean,
Keisha.
that was 90 minutes. Just said,
Yep.
right.
Keisha.
Oh yeah, that was a good way to, and I was just thinking about the complexity of different counties, but for that one, that worked real well. But yeah.
Awesome. Good. I appreciate you all being so clear about what's important to you. It made the work a lot easier. And I just want to celebrate. Look, we got 2. Let's go. Let's go number 3. All right. Don't worry, I'm not going to do that every time. All right, next we've got Columbia County.
Can I just mention, for me to process this information, it's really helpful to have the PDF. So thank you for sending that out.
Awesome. Thank you, everybody. It really does take a village to grant $427 million. So, okay, Columbia County. We're going to start with at home base here. Here's all of the applicants and all of the things they applied for. You'll see the blues and the greens and the orange. I'm not going to do the whole rigmarole because now you know. If you have questions, please holler. Remember the
Conflicts?
I'm sorry?
Did you call for conflicts?
No, Columbia County. This is a call for conflicts. Could you please holler if you have an actual or potential conflict of interest for Back to Basics Recovery, Boulder Care, Columbia Community Mental Health, Iron Tribe, Medicine Wheel Recovery? Those are the applicants for Columbia County. Does anybody have an actual potential conflict of interest? Thank you for the save, Dharma.
I just wanted to mention too, since I don't think we mentioned it on the call at all, that like the standard is to turn off our cameras and to mute as well during during any discussion of when you have a conflict of interest
Yeah,
just
if
so
you have a
the new
conflict.
members know.
That's right. Thank you. I know we have a whole conflict slide that this isn't a slide, this is just my screen here. So okay. So you see the 1, 2, 3, 4, 5 applicants for Columbia County. It's a small county. The total application the total formula is $5.9 million available. And you'll see here the total ask was 15.7. Here are the panel review recommendations, which are limited to just a few of the existing grantees. Again, before we heard your priorities, we can talk more about that if you have any questions. And here goes the legwork to include the organization, the priorities you assert. So these are the 1, 2, 3, 4 that are existing grantees and or indicate they are culturally specific in their application. And you can see looking across the service areas, everything is covered from screening to harm reduction. And now coming over here to the math. And again, I can try to make those columns squeeze in if needed and ignore this on the right. This was just my cheat sheet, trying to give myself a grid for doing the work. And every time I do this, I forget what the cap is. So I'm sorry, it's just 6. Looking at the admin and indirect and taking out those types of funding, not positions, but funding in the grants, less any expansion, the total service reduction gets us below the cap already. And so we don't even need to toy with the 70%, but I put that in there because you asked for it. And so the question then is, with it being a little bit of wiggle room, please assert what you would like to see back in it. Hunter, please.
So how much is the wiggle room?
5.9. Let me.
So it's like around 700,000.
Yes.
Okay, so we could add expansion back in and evenly add in the admin indirect like we did last time, less the the CMHP, which I believe there's one in this one. It's just an idea, seeing what the council thinks. It's kind of that same formula.
Dharma?
Is the expansion for this one Boulder cared for harm reduction?
One moment.
Sorry.
Yes.
Oh, yes. Okay.
Yes.
In this case, I would probably advocate just for a split up of it because it's I don't think that they provide the best harm reduction services. I think it'd be better spent to split it up, but it's only $87,000. I would just leave it.
The only thing, channeling my inner panelist, is that having more than one harm reduction provider in a county is good, even if it's just by mail. And I know that Boulder Care services are unique, but I want to make sure that we're giving folks options, and if a telehealth option might be good for some residents of Columbia County. That's what came through the panel review, at least. Sabrina?
Yeah, I just wanted to ask, so Boulder Care's harm reduction would look like Narcan and telehealth harm reduction services, or they'll send it to you in the mail?
Morgan knows.
I mean, it's mail, right? We've established this. Yes, they have remote peer mentorship through the app, and through that relationship, also do mail-based naloxone and harm reduction consultations.
Ron?
No, my recollection is what their harm reduction proposal is to obtain naloxone through the clearinghouse, and then
Can they leave that 87 out to give Jason some direction with math? Hunter?
Okay, I definitely defer to the expertise of my fellow council members on that. So then another idea could be split up the remaining 710 among indirect. The other, I think it's, let's see. Yeah, among those other three agencies, due to one of them being a CMHP, and that might appease what everybody's thinking.
To be clear, you're saying not to do the CMHP and do the other two?
The other three, yes. Isn't there 4 agencies?
So it's Boulder Care. I believe Columbia Community Mental Health is a CMHP. I want Kathy to affirm that since she's got that as a resource. Or deny it if I'm wrong, but I know Iron Tribe and Medicine Wheel Recovery are not the CMHPs. So Hunter, would that be dividing the remainder between Iron Tribe and Medicine Wheel then?
Yeah, what would that look like? And yeah, I mean, that would get them close to where they need to be.
Ron, oh, Ron's hand went down.
no, that was right. I just was gonna agree with that.
Okay, Morgan?
Just on a reduction here, the Columbia Community Mental Health, did they take the biggest hit by far? Is that what I'm seeing? Let's see here.
Yeah, their ask was 4,328,000 and got them down to 2 because this was a small county with that 2 million guideline base.
They are the CMHP.
Thanks, Kathy.
And they're currently funded to provide all services, I think, maybe.
Yep.
Except housing.
No expansion. Same as last time.
Same as last time. Okay.
Hunter?
Yeah, with Iron Tribe being the only agency or entity providing housing, I think it's important that they get whatever funding we can possibly give them, since it's the only agency, they're the only place in that community doing that.
Okay. Look at Jason's math gets us like just 100K below the formula.
Awesome.
Does anybody want to assert where the remainder should be delegated or assigned or gifted?
I would just leave it. I feel like there's at some point too we'll have to leave some for the negotiations, right? Like we don't have to get right on the dollar.
Okay, great. All right,
I'd
I'm gonna
move to
zoom
approve
out
this.
again.
Yeah, I would like to make a motion then. Oh
All
wait,
right.
Ron has his hand up.
Oh,
No,
sorry, Ron.
I would have just put more into housing That's all. The 100,000 in the housing.
Do it.
I did put it back up to their original ask, so there's no reduction on their ask at this point, Iron Tribe.
Okay, great.
They're getting their full ask.
So could that remaining funds go to Medicine Wheel?
Yeah, I would support it.
Before I make a motion, to see Keisha has her hand up as well.
Oh, I'm sorry, Keisha. Go ahead. I missed you.
No, I was just gonna say if we can get to the number, let's get there and not leave it up for negotiations. But go ahead, Hunter, make the motion.
Okay. I make a motion to approve funding for the existing provider OAC recommendation panel, as is with the numbers that Jason has made for us. And thank you, Jason.
I second that.
Oh, all right. So Hunter moves and Keisha, and I think Sabrina with a close third seconds it. Any discussion?
I just feel like I'm getting a little confused here because there's the existing providers, culturally specific, gender affirming, non-medical, and then existing providers only.
Yeah,
really
that's right. Because some providers are new and they are culturally specific, and those are included if they exist in that county.
And Hunter, your motion was for the existing providers, culturally specific, gender affirming, non-medical. That one, right?
Yes. Yeah. Good point.
Okay. Any other discussion?
Yeah, I would just probably clarify the motion so that it's specific to that middle option.
I did label it option 3. If you just want to call it option 3 again, I think we can go with that.
Yeah, should I make the motion again? Because I'm not going to remember exactly how I made it. Can I make an addendum to that motion?
Is it in the chat?
It is not in the chat yet. So Hunter, if you want to rescind your first motion, what you could do is do that and then make a motion to approve option 3 for Columbia County.
I'd like to rescind my first motion, and I would also like to make a motion that the OAC approves funding the existing providers, culture-specific, gender-affirming, non-Medicaid services partnerships panel with all budget adjustments as previously discussed and on that slide now.
Second.
Hunter moves, Keisha seconds. Any other discussion? Let's do a vote.
Amy, how do you vote? Oh, not Amy. I'm sorry, she's gone. Ami,
Yes.
Caroline,
Yes.
Dharma,
Yes.
Hubert,
Yes.
Hunter,
Yes.
Keisha,
Yes.
Leticia,
Yes.
Linda,
Yes.
Mason,
Yes.
Melissa, she's not here. Morgan,
Yes.
Ron,
Yes.
Ryan,
Yes.
Sabrina.
Yes.
That passes with 12.
Congratulations. Good job, everybody. Moving on to Coos County. Okay, Coos County is a small county, so keep $8.1 million in your head. That is their formula amount. And here you've got home base, and I will do a call for conflicts. Is that why you're raising your hand, Dharma?
And I have a conflict of interest.
Okay, all right. Let me tell the providers and then give folks a beat. So the providers in Coos County are ADAPT, Bay Area First Step, Boulder Care, Coos Health and Wellness, HIV Alliance, and Youth Era. Are there any actual or potential conflict of interests, Dharma?
I have an actual conflict of interest with HIV Alliance.
With HIV Alliance, okay. Mason?
I have a conflict of interest with Youth Era.
Okay. Anybody else? Okay, and so thank you, Dharma, for the direction. Is the what you do is you turn off your video and you don't participate in the conversation. If we don't have quorum and we need to do a vote, then folks are going to be able to participate. So we're going to dive right back in.
Can I ask a quick question? It was Mason, and who else had a conflict?
Dharma.
Thank you.
Welcome. Thanks, Kathy. Anyway, so there are the 6 providers. The only new applicant is Boulder Care. The remainder are existing grantees. You see the service array here from screening to harm reduction. Yes, Sabrina?
I'm sorry, I previously put a conflict of interest in for Bay Area First Step that no longer exists, and I didn't think about it until now. I never sent you paperwork, but that conflict no longer exists.
Okay.
Okay.
Thank you for that. Appreciate your transparency. So the formula is $8 million and the total ask is 15.4. You see in the yellow here. Going down to the panel review recommendations, you see the panel reviewers went primarily with existing, well, only with existing grantees, but did not include all. They didn't fund Coos Health and Wellness, but did get to the formula amount, which again was 8.1-ish, got to it. So here he is. Well, I'm gonna do this option 3. No, I'm not. So yeah, existing providers, these are your priorities is option 3. I went ahead and took all of the hard numbers and did the reduction exercise. And the total NTE not to exceed is 15. The admin total was 3 million. There was expansion for adapt, and that was it. And the total reduction, we could get it to 5. And taking the $2 million cap for a small county, again, contrasting that with these, NTEs, which are $5 and $4 million. So 2 is a lot less, just noting that. We get to $10.4 million, which is still above the formula. Per your request, I took it down to 70%, but that gets way below it to 5. So my question for you is, do you want to reduce to the $2 million cap and then take an additional percentage to get to the formula amount? Or what other formula or suggestions do you have, Hunter?
Can I see that bottom slide with the existing burn fighters only?
Is that right?
The existing providers only, the bottom
Oh,
slide?
I'm so sorry. I apologize. These are just the existing providers. My bad. And here we go, bringing the less admin and under that $2 million cap gets down to below the formula. I think it's
Okay.
8.1. Right. 6.
Bear with me here, everyone. I know that
Sorry, what's the cap?
8.1.
8.1. I know that we've been going with the recommendations in the middle right there, but the only difference that I'm seeing is Boulder Care. And of course, we want more than one harm reduction, but this is a harm reduction. We've already got Bay Area First Step and HIV Alliance. So I'm wondering, do we need Boulder Care there? I mean, I know we do. So I don't know if we do. I just wanted to put that out there.
Great. Awesome exploration. Keisha, go ahead.
Yeah, I was just looking at that, and that screening is sky high. So I'm just wondering, yeah. So are we doing the reduction just in service areas or the cap for everything?
Well, you suggested y'all voted into starting with a cap and not reduction by service area. And so that is
Okay.
what is provided over here on the right where you see Jason's pink initials here, bringing adapt down to 2 million.
Okay. And then how far are we from the formula?
For the existing providers only, way under.
And then was it some more culturally specific organizations that we needed to maybe look at?
These are all of the ones that asserted they were culturally specific. They are included here, just Boulder Care, but you know the answer to Boulder Care's question.
Okay.
Yeah. Dharma?
I just want to say that having telehealth options in rural counties is like a deal breaker for us because like there's not a lot of service providers sometimes, and regardless of I think Boulder Care being culturally specific or not, right? Having an option in a rural area can save your life, and so I just really would say they're not my they're not my favorite option for someone. I think that, but I think that like if having a telehealth option is really important for rural counties, though.
Linda.
Yeah, I just wanted to comment on the Boulder Care as well, because I'm noticing that the review panel did not recommend it. I think not funding Boulder Care here does not mean there wouldn't be any telehealth options because Boulder Care will see anyone still. They still exist and they can bill Medicaid for SUD. And there are other kind of telehealth options that people can access. And my experience is that like when patients want to access telehealth rurally, they can't, like there is capacity right now for providers to see it. So see people. So I guess I'm advocating for prioritizing some of the other services.
Okay, thank you. Dharma.
I guess I definitely hear you. I would be worried about like if we had like because we're required to set up the services as if there's a full array with MS around 10 funds. I'm wondering if we can like rely on the outside services as meeting our values as much. But I hear you on that as well. But I think with only would they only have one service provider? Well, I guess Adapt in Bay Area First Step. Um, yeah, I guess that makes sense to me if they would still have the option, but I don't know if we can rely on the options outside of the uh array that we're voting in, but I understand.
Yeah, this is definitely a soup thinning exercise. Keisha.
Sorry, yeah. I would like to, if the second one was we're still below formula. I would like to see some more money go into Bay Area First Step. Their scores are off the roof, and I think they have a center there too.
And would you like to see those numbers in the option 3, which are only your priorities, or number 4, which is existing providers only?
So which one are we working? We're not working with the one.
No, we're having actually a conversation about Boulder Care, so I'm not sure which example, which option is the one we're going to hone in on.
So is that the only one outside of the existing providers?
That's correct.
Yeah, so I guess we're looking at existing providers.
Okay.
That's the one we're below cap, right?
Well, after many cuts, but yes.
Yeah.
So I'm just gonna, and Sabrina, I got you in just a second here. So here's just a reminder, the total requests are over 5 million and 4 million, bringing those folks down to 2 would be a significant change. Just noting that. Sabrina, you're up.
Yeah, I kind of like the same process that we've been using, going with the existing providers and then divvying the money up between them in the admin cost. Is that what we've been doing?
Yeah, we're possibly even adding back service areas that were cut or the dollars that were cut. So that would be first starting here with the 1.8 that was removed from Adapt, putting that back, and then with whatever remaining funds to distribute between the other applicants, and y'all can decide if you want that to be the CMHP or not. Keisha, is your hand back up or is that a stale hand?
No, well,
Okay.
what who? So you said we're adding 1.8 back to adapt for what reason?
No, that's an option if you want to. That was an
Oh,
expansion that Adapt had. That's an additional service area that they applied for.
oh yeah, because that screening is ridiculous. But can you tell me the number that we have left?
So for existing providers only, you can see Jason down here. We're at 6.8 after significant reductions, and our goal is 8.1. So $1.3 million is thank you, Jason, is what's remaining.
Well,
And I got so go ahead, Keisha. I got some hands up behind you.
so I was trying to I think Bay Area First Step should get some money. So that's why I was trying to get to where we're at because anyway, maybe 700,000 for that to Bay Area First Step.
Hunter.
There's 2 points that Keisha's making that I agree with, and I want to point that out. First, I think that screening is sky high and doesn't really make sense to me. And I also believe that if Bay Area First Step has a center down there, and so those are services that will never become viable through, if it's a recovery center, then if that's peer supports that don't work under like a CADC, then they won't be able to bill Medicaid. So we need to make sure that we either continue to stand them up, and all those things. I think that something could go back for in place of that 3 million or something from the screening, but I believe that divvying it up among, so I think something can go back to adapt, but with making sure a chunk goes to Bay Area and then the rest split amongst those agencies would be a fair way to do it. Now, what those numbers are, I'm not sure, but I think that I agree with both of those points that Keisha's making.
Okay, so there's $631,000 left. Do you have thoughts about how you'd like to recommend that be redistributed, Hunter? And then Linda's on deck.
Okay, 600 after what? What did we change?
So here we're working under this column, less admin and under
Oh,
2
okay, we put the
million.
700,000 towards Bay Area. Okay,
That's right.
Okay, so we take out Coos Health and Wellness because they're the CMHP, and the 600,000 with about 200,000 each going to Adapt, Alliance, and Youth Era, and whatever the difference is around that. I think that would be a fair and equitable way to do it.
There's some heads nodding. Linda, what do you say?
I think I agree with a lot of what Keisha and Hunter were saying to add into the budget for Bay Area First Step and reduce the budget for ADAP screening. Can we just, I mean, I can like propose a number, like 1 million seems like still an absurd amount of money for screening, but I also didn't read their application, so I don't know if any of the reviewers can comment on like what they were planning for that.
I will just note that their total ask with that massive screening sky high amount was $5.6 million. And what we're talking about right now is 2 million. So that screening amount would have to come down. And if y'all had a suggestion of what's a reasonable amount to budget, we're happy to make a note when we move into negotiations about what that should be.
Oh, gotcha. Thank you.
Mhm.
There's no reason to come up with a specific number for the different services.
Any other thoughts? Keisha?
Yeah, did we get to a final number?
I think Jason's working on it. Oh, he just did it. There it is. So it's 2.2 for ADAPT, 2.7 for Bay Area, 919 for Coos Health and Wellness, 1.28 for HIV Alliance, and 1 million-ish for Youth Era. And that is the existing providers only chart.
Okay, and how close are we?
On
I just
the
want to make
nose.
a motion.
On the nose.
On the nose. Well,
On the nose.
I make a motion that we move forward with the existing providers only proposal. I can't see a number on the proposal, but
Second.
Oh, I guess we're in discussion.
Yeah. So Keisha moves, Hunter seconds. Discussion. Linda.
I guess I'm just thinking about there's like a huge lack of youth services. So I think I may be advocating to move we gave ADAPT like a bit extra over their 2 million, but I'm wondering if we should give it to Youth Era.
So as a reminder, Youth Era's total application was $1.2 million, and so far we're looking at 1.05. So it's like a $200,000 less.
Yeah, I guess we're close. I don't feel super strongly about that.
Okay. Any other
in case other people have that.
Okay. Any other thoughts, discussion, Keisha and Hunter? So Keisha, yeah, go for you first.
oh no, I'm ready to vote.
Old hand. Hunter, new hand. Go ahead.
I have no discussion and I'm ready to vote.
Okay. Any other discussion? Ron.
I too have no discussion.
Oh my gosh, you guys are killing me. All right, let's take a vote. Go ahead, Carly.
On me, how do you vote?
Yes.
Caroline?
Yes.
Dharma? Oh, sorry.
Same, sorry.
Hubert? Is he still? Yeah. Hubert, you can vote in the chat too if you can't unmute.
Yeah.
Thank you. Hunter,
Yes.
Keisha,
Yes.
Leticia,
Yes.
Linda,
Yes.
Mason,
I had a conflict with that
oh,
one.
I'm so sorry. I'm not paying attention to that. Morgan,
Yes.
Ron,
Yes.
Ryan,
Yes.
Sabrina,
Yes.
and that passes with 10.
All right, I'm just going to keep plowing forward, and we are moving on to Crook County. Y'all are going to love this. And I am going to do a call for conflicts. Our applicants in Crook County are Best Care Treatment Services, Boulder Care, and Rimrock Trails Treatment Services. Are there any actual or potential conflicts of interest for these applicants in this? Okay, hearing none, we're at home base. So you can see that Best Care and Rimrock are the existing grantees. Caroline's in our hotel room. Welcome, welcome. And Boulder Care is the only new applicant. And the total request is $3.9 million and the cap is 3.4. So it's only 500K over, even funding everybody for all the things. Moving to panel review recommendations, the panel reviewers recommended bringing, oh gosh, who was it? Bringing Best Care down to meet the formula amount. So the reduction for 500,000 was there. Let me just double check. No, I'm sorry, my bad. It was reducing Best Care a little and reducing Rimrock Trails Treatment Services a little bit. And here are your priorities. All of the applicants indicate they do provide cultural specific services in some shape or form. The total NTE request, as you recall, is $3.9 million. When we start taking out indirect, we're already going way under. So I want to just pause here and let you take a quick look at this and see if there's anything you want to ponder. And just for the last minute here, I want to show you just existing providers only, which does not include Boulder Care. And you'll see that the total is 3.5, which is almost exactly the cap amount. Hunter, go ahead.
So what would it take to get the middle one, the OAC priorities to budget? If we're at 3.9 and the cap is 3.4, that's about $500,000. What if we evenly split that up like amongst the three, because with it being a rural county, I think having Boulder Care there, to Dharma's point earlier, would be a good idea.
The only other thing I would highlight, just to add to the, not just to add as your facilitator, is that this blue SUD for Rimrock was recommended by one of the two reviewers. Take it or leave it, but that's just an additional piece of data for you to consider, and we'll move to Dharma.
I think this is a lot smaller of a county than like geographically than the other what I'm thinking of the rural counties. So I'd be comfortable with the existing providers only on this one, but I wonder what other council members think of that.
Great question. Keisha?
Yeah, who is the CMHP there?
Please hold.
Crook County Mental Health.
So the CMHP did not apply.
Oh, okay.
Crook County Mental Health has not applied.
Thanks,
Okay,
Kathy.
gotcha. Thank you.
Yep, Ron?
Yeah, I just wanted to agree with Dharma regarding existing providers only for this county.
And I know it's a little bit over, but it feels like okay.
It's barely over, but let's go to Keisha. Is that I'm sorry. You raised your hand again? No, you put it down. Ron, did you have more? Your hands up? Nope. Hunter.
So we have just right at like $101,000 over. And so if we split that up amongst the two, would the council be comfortable if they just split the difference on that and then we could approve them and move on? That's what I'm wondering.
Yeah, like let them decide where to take those reductions and leave it at that.
It's a good idea. I can make a motion.
Do it.
I make a motion that we approve existing providers only panel with the $101,000 difference being decided later in negotiations with Oregon Health Authority.
Second.
So Hunter moved and Dharma, did you second?
Or Hubert, either one.
Hubert, I'm sorry, I couldn't tell. Thank you, Hubert. Second, discussion, Keisha.
I just would want to just go ahead and divide the overage right now and let it be done. That's the only change I would make.
I can rescind. What does the council think about that?
I think it's a good idea. That way there's no negotiations required.
Yeah, so it just gets done. Okay, I would like to rescind my previous motion, and I make a motion that we approve existing providers only slide with the 101,000 overage being split up evenly between the two providers in the county.
Well, that doesn't make any sense to me.
Second.
Hunter motions, Keisha seconds, Dharma has a question.
What do you mean like the overage is just split amongst them?
So it would be like 55,180 something dollars each, or 50,000, whatever that looks like. Yeah, 50,662. So they would both take that much of a hit off of their budget, and it would be an even hit across the two.
Isn't that what we just were voting on though? I'm confused.
No, we were gonna go to let them negotiate it afterwards with OHA. This one is no negotiations. We settle it now and move on. Correct, everybody?
Where are we taking it out of?
Yeah.
Out of both budgets. So they both have their budgets, their NTE, and so they both off their final NTE take a $50,662.75 hit on their budget. And
I understand that much, but where from their budget? Like,
So may I assist? You all had decided that if there's a budget reduction, that the entities would figure out how to best make it work. And OHA, we're still going to have to go back to the providers with a new NTE and like talk to them, right? So it's not just like surprise. We would have a conversation about that. Any other discussion or questions? All right, let's vote.
Ami, how do you vote?
Yes.
Caroline?
Kind of confused. So did we go back to the original motion?
Yeah, it's the one that's in the chat.
Okay, yes.
Thank you, Caroline. Dharma?
I'm also confused, but yes.
Hubert?
Yes.
I'm sorry, was that a yes?
Yes.
Thank you. Sorry, my dog is going crazy. Hunter?
yes,
Keisha?
Yes.
Leticia?
Yes.
Linda?
Yes.
Mason?
Yes.
Morgan?
Yes.
Ron?
Yes.
Ryan?
Yes.
Sabrina?
Yes.
And that passes with 12.
Fabulous. Sorry, I should have kept the screen up so folks can kind of look at it while they're voting, but I'm trying to work ahead and move into the next county. So I apologize for taking it down too soon. Okay, moving on to Curry County. This one's a little more complex, but that's okay. We got this methodology down. Okay. So a small county and, oh, I'm going to do a call for conflicts, Dharma.
I have a conflict of interest with
Okay,
APL. I'm
thank
sorry.
you. I promise by the end of, I don't know when. Okay, so our providers are ADAPT, Bay Area First Step, Boulder Care, Brookings Core Response, HIV Alliance, and Oregon Recovers in Curry County. And so please holler in addition to Dharma if you have an actual or potential conflict of interest for any of these counties, providers.
I'm sorry, did Dharma say she did have an actual?
Yeah, she
Okay,
did.
perfect.
Okay. So interesting phenomenon in this county. There are 4 new applicants and 2 existing providers. You see the orange and white color coding there. And that none of the reviewers recommended funding any of the service areas for the Bay Area's first step application. So that's a thing. And the total ask across the county is 9.7. And again, it's 3.9 is the total cap formula. The panel review recommended this, funding Adapt, Boulder Care, Brookings, and HIV at this amount. And here are your priorities. Looking at only existing providers and folks who are culturally specific. Would be Adapt, Brookings Core Response, and HIV Alliance. And you see their scores there, and every service area would be covered, except assessment. We would need to unpack some of that. Oh, I'm sorry, Keisha, I didn't see your hand. Go ahead.
I'm sorry, but I'm thinking when we reviewed this, Bay Area First Step was setting up a tribal housing or something like that.
I don't recall. Y'all have the applications. You're welcome to pull it up to get some details. I don't have enough screens to be able to do that to help. So please go ahead and explore that, and I'll just keep going through the rest of this. Okay. So just with these existing providers, here we go. And HIV Alliance, who indicates they are culturally specific. The NTE amount, the total is 6.3 million, which is still over the cap. Taking out the admin or indirect is the totals here. The reduction being respectively 300, 157, 110,000. And then trying to get closer to the cap. Oop, this is an error. There should be 3 million on the nose here on this one. Still being over the cap at 5.7. So this is one of the hard ones. And then taking it down even further, the 70% after all those reductions is still over the cap at 4 million. And the cap, I'm sorry, I should have brought it down with me. Yeah, 3.9. So 4 million just about does it. If you just go with existing providers, which is Adapt and Brookings Core Response, you've got all the service areas covered. The total NTE is 5.1. If you take out indirect, the total is 4.6. We could take this 3 million down to a $3 million cap, which be a little bit closer to the formula. But again, it would need to have some of a reduction to get.
I'm also having.
Oh no.
For this one.
Yeah, just this one? All of them.
Yeah, when I open them, there is a little drop down arrow and it gives you an option of which applications you want to use to open the zip file after you hit it. But when you first hit it, it does look, and my computer won't let me use one of those without adding software. So right now I'm not able to see the zips either.
Oh no. Carly, how did you and Leticia figure out the tech? Did you figure out the tech?
Well, we thought so. Nikki actually helped me zip them into different files, and we sent them in smaller files, but I don't know if it's still having that problem.
It worked when you sent him in smaller files.
Okay, perfect.
Yeah.
So Mason, you should have a second set of emails.
Oh, because Carly sent them all over again. Why? Because she's Carly. That's why she did that. Great. You can see them in the smaller files. Great. Thank you. Make sure that's working for folks. And then we'll dive back into the discussion. And my question is, based on what you're seeing so far, where would you like to kick off the conversation? Hunter.
I have a question for Keisha. Keisha, were you on the review panel for this county?
Right. Yeah, I was on the review panel and I'm trying to find it in here, but I know they were gonna set up tribal housing and so they had a lot of culturally specific themes in there. I just can't remember it verbatim. So I'm trying to find it in the spreadsheet.
And that was Bay Area First Step?
Yeah, and it was way before we had our priorities too.
Mm-hmm.
So we scored different back then than we have been recently.
Carly, do you mind resending? I think me and Mason are both missing it.
Yes.
Mason.
Given the significant that it's like significantly over, and we some of us haven't had a chance to look at this one. Is there anything else on the agenda that's perhaps like simpler, or is this just going to go uphill from here?
No, I mean we can take a pause on Curry County and move into Douglas.
Just in the interest of like
Yeah,
building momentum, maintaining that.
absolutely. We'll make sure that, make sure you can open the applications, and if you can't, let Carly know. We can work around that. Sabrina, go ahead.
Yeah, I watched the Curry. This is Curry. I watched the Curry County one, and I remember I wrote some notes about them not funding Bay Area First Step. They were adamant about not doing it. The reviewers that did do it. And are we in discussion because I'm hearing council members wanting to fund them, even though both the reviewers decided that's not what they wanted to do, or is it because we have due guidance, or what direction are we going?
What I'm tracking is that there was like wait a minute, didn't this organization say they were going to do something that you might want to look at? And so balancing that, because both of the application reviewers did not recommend funding. And so one of the things y'all can do is you can also go back and watch that video, right? And get a sense of what the reviewer said. I've got the application up kind of behind you guys. I'm trying to assess it quickly, but happy to move on to another county. Hunter.
In the interest of time, I'm okay with moving on to another county, and I'm going to do my due diligence like this evening if I can, and I want to know more about that because if there's going to be a travel program at Bay Area First Step, I think they should be involved in the funding and the voting. I just wanted to point that out.
Great. We could take a minute and look at that application and make sure they're well informed before having an opinion. That's what I'm hearing.
Yeah, well, and also I defer to members of the council who have been here longer than me as well. I just want to make that point. So if Sabrina and Keisha know things that I don't, I would like to hear their input at all times.
Okay.
Thank you, Hunter. I appreciate that. I don't mean to jump in, Abby. I just want to make sure as we're moving forward, if we're putting a county on hold, what is the thought process behind that? And if they are, if I'm hearing correctly, we're weighing one way or another due to the fact that they might be providing tribal specific services. And if that's moved off the table, are we still going to take that into consideration? For my thought process, that is important. So I understand that other people aren't there, but I also want that piece of information before we, put that on the table for later. So thank you, Abby.
Mhm.
Can I jump in there?
Yeah, please.
So what I'm hearing from Sabrina is that if this agency is providing tribal specific services, that the council would like to take that into account and make them part of the funding vote. Is that right, Sabrina?
Yeah, that's what I think I thought I heard you and Keisha
Yeah,
saying.
that's
And
what I
if,
was saying too.
yeah, and so if they're not doing it, then are we going to then remove them off the table? So that's what I was just wondering. So that way I understood as we move forward.
I believe that would be my process, but
Yeah, and I'm not sure the tribal piece was the only piece. It could be some more culturally specific. Yeah, I was one who, didn't understand the form, the way it was done, but everyone can take a look.
Ron?
Well, the reviewers both reviewed the application and both said that it was, not moving forward from their point of view. So if the council wants to reconsider, that's the council's prerogative. My question, what I want to say is I can't open that file.
Keisha?
Yeah, I was just responding to Ron. Yeah, both reviewers reviewed and they didn't, but the priorities were different as they reviewed. So we have to take that into consideration also.
Right. So the OHA would need to re-examine through the lens of the priorities of the council.
So I just want to make sure I'm deciphering the difference between the raters who actually read this whole application and gave it scores versus the review panel who took it all into consideration and heard and had discussion and made the recommendations to move forward or not.
That's right. And so the recommendation from the
Yep.
panel was
Yep,
no.
the panel. That's right. Keisha, your hand's still up. Is that old or new? Old, Morgan?
So the reviewers are both no and the panel's no? I'm sorry.
Correct.
Correct. So that,
Nope.
wait. No. So that wouldn't have been influenced by shifting priority decisions, correct? That just the reviewers no would have been a no, would have been a no.
So I think it's going to be important because if there are questions and concern about an applicant, that you will take the time to look at the materials and let's make sure you can get them. And it may be super tedious. I'm sorry, Carly, to send out things one at a time. But let's not kind of get lost in this and make sure that you all are well informed because that's the most important thing. And I would like to propose that we pause on Curry County until we can make sure that you can actually open your materials and then pick up the cover. We got plenty of other counties to discuss. Okay, Keisha?
I agree with that. Thank you.
You're welcome. Okay, I'm going to turn Curry County a different color so I can remember it's going to be pink. And we're going to move into Douglas County. You ready to move on? Great. Thanks, team. Let's do this. We did split up the responsibilities of putting all this information together so the formatting might look a little different between us. Oh, except Jason, seriously, he's fixing things before I can even really say they're a problem. Never mind, it's beautiful. Douglas County is a medium-sized county and their formula is $15.9 million, so 16-ish. You'll see here the applicants that I will call for conflicts in a moment are for ADAPT, Boulder Care, HIV Alliance, and Oregon Outreach Clinic. Are there actual or potential conflicts for any of these applicants in Douglas County?
I have a conflict for HIV Alliance.
Sorry, you do have an actual conflict?
An actual conflict for
Okay.
HIV Alliance, yeah.
Okay, missing you today, Dharma, but thank you for that. Anybody else? Okay, so here we've got home base. You'll note that both of the people who read the applications did not suggest funding SUD for Oregon Outreach Clinic. And here in the panel review recommendations, the panel went forward with that recommendation as well. That did bring down the amount to below the formula. Here it's 5.1. The formula is 5.9. Leaving ADAPT and Boulder Care Provider Group to do the SUD treatment in that community. Okay, I'm going to move on. Existing providers, culturally specific providers, all of your priorities. This is the next one. And it really is just the three existing providers. And you will note that there is a gap with assessment, so that would need to be fixed or addressed. And so when we start to move forward, you see the total is 14.3, and Jason's already put in the cap there at 15.9. So there's a little wiggle room. And again, we would need to make sure, however possible, that assessments are provided with DTRSF funds in Douglas County. So it's unnecessary to kind of go farther down the line to look at other reductions because we are within the cap. Of course, we would need to negotiate the assessments. And then the existing providers is pretty much the same information. And I'll bring you back up to Oregon Outreach Clinic because they were the only assessment provider who was moved forward by the panel reviewers. Hunter.
I'm liking funding the existing providers, culture-specific, gender-affirming, non-Medicaid service partnerships panel with the remainder of, we have 1.65 left over, correct? Like we have that to use to fund, and funding Oregon Outreach Clinic, so there's an assessment piece in that county, and then the rest of it to split up how the council sees fit. That's just my first idea is what I'm thinking.
Can I get a confirmation, clarification, Mason, before you come in? So Oregon Outreach Clinic applied for 620. Hunter, is that what you would want to fund?
Yeah, because we have more than that, right?
Yep, we
still
do.
have over $1 million left that we could split up among the existing providers.
Totally. I just want to make sure that I understood. Thank you for
that's
that.
my idea.
Great. Ron, go ahead.
In the interest of consistency, I'm just looking at the $3.8 million for screening for ADAPT.
Wow.
And it just seems out of line from what we've been doing. And so if I had a recommendation, I would reduce that and then reduce that, but then we're still under, but I just can't rationalize $3.8 million for screening for ADAPT.
Shoot, sorry. Hey, Mason, sorry. Go ahead.
Good. I do agree with Ron about like staying consistent and not quite knowing the justification for that high number. I also think that the remainder that we have being split between the two organizations who are fulfilling the housing need, I think there can never be enough money put into housing when it comes to these kind of services. So that would be my suggestion for how to divvy up what is left afterwards.
Okay, prioritizing housing. I also want to make sure that folks are seeing that we don't know how much ADAPT is offering to spend on SUD treatment because they left that blank, but there's a big program cost. And the only other provider in this list is the remote provider in Boulder Care. So, Hunter.
That was going to be my point, that I wish we had a dollar amount on the SUD spot. Yeah, so you beat me to it.
I'm sorry. I apologize. Leah?
It looks like, so we removed the SUD piece from Oregon Outreach Clinic, right, based on review panel recommendations. I guess I would suggest maybe adding that back in. Seems important to do assessment and the other stuff.
Okay, so recommendation to fund Oregon Clinic for both assessment and SUD with the quote unquote remaining unallocated funds.
I would almost always also advocate for moving some of the screening over to SUD if we are having budget issues but I can't quite tell what the numbers are.
So Jason is showing us that we are about 500K over with funding Oregon outreach clinics to service areas.
What county is this?
Hold on, Keisha, I've got hands up. This is Curry County. Hunter?
What if we took that from the screening on ADAPT? That overage right there. It's just an idea, but it's still going to be a lot for screening.
Thoughts?
I second that.
Okay. So taking that delta of 569,000 from screening from ADAPT. Ron, and then Mason.
I'm sorry, I started reading something, but we were not moving it to Oregon Outreach Clinic, right? Because from my recollection of Oregon Outreach Clinic, there were some serious concerns regarding their low barrier substance use treatment. The proposal was to hire coaches and use interns. And that was, and then hire additional coaches. And there was really no definition of what these coaches are or what these interns are. But there were no, I could not find CADCs or peer support specialists in this application.
And thanks for
That's why there were no.
Okay, thanks for the correction, Caroline. This is Douglas County. I apologize. Go ahead, Keisha.
Sorry. I mean, I know I don't know. I just still feel like we should set a cap. I know that this ADAPT applicant is way high. And I don't think we should just throw it at them just because. I think we should set a cap.
Hunter?
Hear that. So if we do set a cap on that screening, let's say $1 million, and that might be low, right? I think that if we did that, we would either have to divvy up that money and give these other existing agencies that are in this slide more money than they were asking for, or go back up and look at other agencies in the first slide and see if there's another agency we can fund to do something else, which would bring another agency into the fold as well. I don't recall what agencies are up there. That's why I'm asking.
Same ones. We just had 4 applicants for Douglas County. Yeah. Caroline?
So I'm getting colorblind. So blue means they were both approved by 2 reviewers?
Blue means one of the 2 reviewers recommended funding. Green means both recommended funding.
Okay.
Orange means neither.
Okay, I'm just trying to, I mean, ADAPT's been around for so many years, and I'm just wondering when we're looking at the burn, if they are doing maybe screening for the other 3 or not, the other 3 entities, because they have to screen them and refer them somewhere. So I'm just kind of, I guess since I didn't read these grants, there must have been some rationale as to why they justify 3 million, 3.8 million. I mean, I just don't want to undermine the reviewers and us making maybe some statements unless we have some facts. I mean, there must be some rationale as to why it's 3.8. So is any of the readers who read Douglas County remember why it was so high?
Yeah, we've discussed hundreds of applications. I don't know if Keisha, Ron, or Morgan remember, but I just pulled up, let me make sure this is the right application. I pulled up ADAPT budget in Douglas ADAPT. Yeah, I have the right one up. I've got their screening budgets up. They are, for screening, it is 9 FTE certified recovery mentors. It is sobering center costs at 500,000, 650,000, up to $792,000 over the 4 years. So it is recovery mentors, 9 of them, and their sobering center for under screenings, according to their budget.
Thanks, Abby. That's helpful to me because if they're hiring like recovery mentors, that's more than just screening, so it helps justify that budget to me.
So I'm sorry. Yeah. So, but they asked for 2.7 in peer support also.
One moment, let me scroll over to there. Yep, more 8 to 9 peers provide outreach across Douglas County and transportation and support. I don't have enough room to read this whole thing. For people who are less likely to have resources, sorry guys, here we go. To allow them to set or reach goals to get off the street. Douglas County is the physically largest county in Western Oregon. The increases by year are for COLA and increased cost of health insurance. So the cost of the peers, those 9 FTE are spread across their service areas from housing, peer support, and screening. That's what that looks like. And the big cost for this screenings is the sobering center costs, which is over almost $3 million. Hunter, so Keisha, sorry, go ahead, and then
Yeah.
Hunter.
So yeah, and we shouldn't be paying for the sober center cost, should we? That seems like a deflection thing or something. I'm sorry.
Sobering Center is funded through community support and operated with minimal staffing. Sobering techs are also peers who provide screenings and build relationships with the people they serve to learn their needs and goals. Increasing support from this grant will allow two staff members to work during higher use times and appear at the Sobering Center to provide transportation to people served. Their interactions are limited to that time while the person is in the Sobering Center. Hunter?
So the sobering center it already exists. This isn't like capital.
Yeah, we don't allow any capital.
Yeah, I know it. So I'm like, are they putting it in there? I don't know. I'm not trying to say that they are. I'm just wondering. It seems like a lot. Seems like a lot.
Great. So Linda, you're up next. I'm curious what thoughts are about bringing this county to in line with their formula, and happy to share any other information. Go ahead.
I like this option that we're looking at right now. Sorry, what's the total formula? Like, it looks like we're at the total request.
That's right.
Okay. So, I mean, I'll motion to approve this. And yeah, people can.
Okay, Linda motions to approve existing providers, culturally specific, gender affirming, non-Medicaid services, and folks with partnerships. Keisha?
Oh, I had discussion.
I second the motion.
Sabrina seconds. Discussion, Keisha?
That was just a missing piece that we didn't discuss when the county, when we have so much in the county formula and only a few providers, like, do we fund these outrageous asks just because it's money there, or what? I just think it's something we didn't talk about.
Caroline?
Well, I'm familiar with Douglas County when I work for the state, and they got quite a large county. And so when you're saying county, they're not located in just one little office. They're spread throughout the county. So when you look at the number of cities in Douglas County, you have to look at this in a different perspective. And there's a lot of rural cities within the county. So I don't think this is unrealistic from my point of view when you look at the size and the number of cities within the county and they're rural. And so I don't consider this to be an outrageous amount.
Thank you,
So,
Caroline. Oh,
yeah, so I would like to second the motion. I don't remember who made the
yep,
motion.
it's been seconded.
Been seconded.
Thank you for the discussion.
Okay.
Awesome. And next is Ron.
Yeah, I'm just looking at checking the math here on this section here. Because it looks like the SUD under Organ Outreach Clinic is included in that $2.2 million.
Correct.
Looks, and it was something that was not recommended. So I'm trying to sort it out in my mind. So if there's two reviewers that didn't recommend it, and it's orange on the grid, then it should be 0 in that box.
So there was an ask because of wanting to have more capacity for said treatment in this large Western Oregon community to add that in. So that is why it's there right now. And this is yeah, that's why.
Okay, because this is where I just described their low barrier SUD was going to be
Yeah, 4 interns and 2
interns and
supervisors.
coaches.
Yeah.
And so, which I think is not fundable.
Do you mind if I speak to that? Or
No,
Keisha,
please, go
maybe?
ahead.
Oh, I'm curious what other people's thoughts are. I looked at their application and I agree, their narrative around hiring interns and coaches is not very specific. But they do say that their goal is to kind of train additional members, which I think is good for like workforce development. And then they say that then they will no longer be supported with a full-time Measure 110 budget. So I feel like for me, reading the application, it sounded to me like they wanted to get interns so they could use Measure 110 money to support their time. And then once they were like fully certified, then they could bill for that and it would become a sustainable model. So I kind of like that idea of training the workforce. And then looking at their kind of project scope, I thought it was relatively robust in terms of what they've done historically and that they're focused on kind of family services.
Thanks for the discussion.
But I totally respect review panel's thoughts too. That's just my personal looking at that. So curious other people's thoughts.
You show your hands up. Go ahead.
Real quick, I just had a quick question. What was the cap for that county?
15.9. Jason's got
No,
it
no,
there.
I mean for each organ, in the application, it's a
Oh,
cap.
sorry, it's a medium county, so I don't I have no resources left. I think medium was 3. Yeah, 3 million.
3 million.
Mhm.
Yeah, 3 million.
Thanks, Jason. So yeah, it's a lot of money, but there's a lot of money to go around, right? I mean, the formula is the formula. So
we're under formula.
now this amount you're looking at here, sorry, I'm pointing at my screen like you can see it, but actually you can. The 15.966 is to the penny, the formula amount. Adapt at 8.9, Boulder Care at 2.1, HIV Alliance at 2.6, and Oregon Outreach at 2.2. Any other discussion?
I have a question for Linda. So is it your understanding then from your read that these are medical interns?
It's not very clear. My impression is that it's probably not medical interns. It
We're
seems
talking about
more like
recruiting college students.
it seems more to me like it would be counseling interns.
Yeah,
But I agree, it's not super clear. Well, they said hiring of coaches and case manager. I mean, case manager, I know what that is, I guess. Interns and supervisors. I guess I agree, it's not ideal. I think that because it's not a huge budget and I kind of liked their overall project scope, talking about like low barrier SUD for families. I'm kind of,
And you do have to intern for CADCs to be a CADC too.
yeah, exactly.
So,
That's what it reads like to me, but I agree it's not super specific.
Any other discussion? Or questions? Hunter?
We have 7 minutes.
That's right. Keisha?
Last thing for Oregon Outreach Clinic. It sounds like they're on a career track because it says that they would have interns until they become certified to become billable. So it seems like a career track with interns.
Anything else before we vote on the motion that's in the chat, which is what you're seeing on the screen? Okay, thank you. Carly, please take a vote.
Me, how do you vote?
I'm looking up some cute. Can you come back to me?
Yes. Amy? Caroline?
Yes.
And Dharma did have a conflict for Douglas County. That wasn't Curry, right? Okay.
Oh,
Hubert?
Yes.
Hunter?
Yes.
Jackie? Keisha?
No.
Leticia?
Yes.
Linda?
Yes.
Mason?
Yes.
Morgan?
Yes.
Ron?
Yes.
Ryan?
Yes.
And Sabrina.
Yes.
And that passes with 10. We passed through 5 counties today.
Congratulations, everybody. That was amazing. I had a goal of 10. I know it was a little audacious. Halfway there is pretty respectable. Thank you for that. I'm really glad this works. I'm tickled that it's helpful for your decision making. So here's the thing. Don't go anywhere. We need more of you. And we're really hoping that you can respond to Carly's doodle poll because we need to find some more times to meet. And just to remember that we need to make these, as a team, you need to make these decisions by February 21st. And I think it's super possible because of this process that you're engaging in. So thank you so much for leaning in so hard today. Carly's got a bunch of holds. And so please, however you can prioritize this is incredibly important. We're in the middle of the legislative session. Lots of folks are watching. It's really important that we get this done. So thank you for your collaboration in response to Carly's email. We will meet as often as possible. We'll meet on the evenings, Saturdays, however you need to do, we'll do it. Dharma.
I'm just hoping that in the future we can just trust the OAC to deliberate some, because I feel like it's really unhelpful if folks keep on reminding us that, like, yes, the panelists and the panel review might have rejected something or not decided to move something forward, but we have the authority to make those decisions still and deliberate it. And I don't think it's helpful to keep on rehashing it, Ron, like to keep on bringing it up, the rhetorical question, like it should be 0. Like I understand, but I feel like it takes up a lot of time to keep on rehashing those kinds of things when we have the authority to just deliberate and move forward.
Hunter?
I just want to say to Ami and Mason, I don't think Josh is here anymore. Welcome to the OAC.
That's great.
Thank you.
Super glad to have you all here. Sabrina, go ahead.
Yeah, my question is to what you were speaking to, Abby. I need to know sooner than later if we're going to need to work on Saturday, preferably at your earliest convenience. If somebody can let me know, because I need to rearrange that with my employer where I could use a computer at.
Totally understand. And we're gonna avoid Saturdays if at all possible, but I know it's a big time commitment. And we're gonna have to dive into some meatier counties. So just respond to Carly's email asking for your availability. And as soon as folks respond, we'll be able to get that scheduled. Thank you, Sabrina. I appreciate that. Okay, I appreciate you all. Thank you so much for this. This was fantastic. Dharma, you want to take us out?
Yeah, I don't have a lot left. Just thank you so much, everybody, for your time. And I really appreciate this refined process. I think it really is building more consensus than anything. So thank you, folks.
Thank you, everybody. Thank you, Carly. See you soon.